Now I am live now. I just figured out I had to actually press the button. Okay. Hello all to my second live. This is Doctora Salerno, Doctor Latina. And I see so many folks that have come back, and I'm so tickled to have you back this evening. I see Jackie Hughes, Diane H., the Honey Badger, Mrs. G, hello. Must have got lost in E-Star. I see Day Tripper. Hello, everybody. I'm trying to figure out how I can get folks' banner up. Hi, Dr. Latina. Hi, Lori Jean. I'm just going to put a few of the banners up, and while I do that, I'd love to know if you feel comfortable just putting the state or the country that you're from. That would be great. Hi, E-Star. Folks want to put where they're from. That'd be lovely. Just to see. And hoping that my announcement on the community page actually showed up. Is that where you all heard about tonight's live? I see we've got Houston, Texas, Florida. I see North Carolina, Idaho, state of Washington, Ohio, and the Gulf Coast of Florida. I see Pennsylvania, as we say, Pennsylvania, California. Hello from Wisconsin. So glad. We've got I've never been to Wisconsin. I hope to go there sometime. Hi, Flor Morena. ¿Cómo está esta noche? I'm assuming maybe you speak Spanish. I don't know. Oh, Australia. That's fantastic. Oh, Moon Bay, California. I've never heard of Moon Bay, but boy, that sounds beautiful. Moon Bay, California. I don't know where that is. Oh, you got from Jewels of Thought. Wonderful. That is wonderful. Oh, somebody was born in Rio de Janeiro. Hold on, let me see if I can get you in here. Live in California, and the answer is yes. Well, good. I see Phoenix. ¿Cómo estás? Estoy muy bien, un poquito cansada. I'm a little tired. Hello from St. Helens, Oregon. Oh, I just saw somebody who's here from Allegedly Innocence Channel. Welcome from Jot, Jewels of Thought. That's wonderful. I saw somebody, Fancy Nancy. Fancy Nancy. Where is Fancy Nancy? Here she is. I'm a little slow. Hi, Fancy Nancy. I'm a stone's throw away from you. Oh, and I see Elizabeth Lander from Charlotte, North Carolina, and Minnesota. Wow, this is exciting. I'm trying to get the hang of how to get folks up here to acknowledge you all. So glad that Jules from Jewels of Thought / Allegedly Innocent arrived, and I also got the referral. We're going to have, God willing, she'll come on board momentarily. Let's see, Mary Michael. Good evening, Dr. Latina. So happy to see your notification pop up. Good, on screen. Was watching another and quickly jumped to yours. Lovely. Oh, South Jersey, the Southern Division. So I don't know if you're from like the Avalon area, Stone Harbor. I don't know, but that is a beautiful area of Jersey if you're near the shore. I'm just going to continue to put folks up here just to acknowledge. Oh, Doctora. Oh, link. Yes, I'm going to try to link Miss Jules here. Ooh, let me see. I might need my moderator, my daughter Francesca. The link. I have to look at the link. Bear with me, my friends. Jules, I've got to figure out the link. I may need my daughter to come out here in Scotland. Hold on. Jules is ready. Yes. Well, evidently I'm not. So I've got to figure out how to. Jules, can you write something to direct me to how to give you that link? Oh my word. I don't see her behind. Let's see. Having issues. Yes, I am. Guys, I'm looking to how to get the link up here. Having issues. Oh, invite. Uh-huh. Uh-huh. I think I'm going to put it in the chat. I believe this is for Jules. Okay, I got it. This is an invitation for allegedly innocent Jules. Tell me how that worked. Hi, Anne Frank. Look at the bottom. Yes, I did. Thank you. Okay. It is a pleasure to meet you as well. I have a little cold, I think, coming up. Excuse me. Oh, I see Miss Jules. Hi, Miss Jules. I'm going to add you.
Okay, let me. How are you?
I am well, but I hear an echo.
Yep, I'm trying to fix that right now.
Okay.
Oh, I'm trying to fix that right now.
I hear that echo.
Okay, so can you still hear it?
Not really. Can you turn your volume up? How's my volume, folks? Because Jules sounds a little bit on the low side to me. Maybe I'm the one that has a problem. We all know I have a problem. But I'm trying to figure out, is it my problem?
I think your microphone is picking up your speaker.
Okay, my daughter Francesca's coming in. Hello.
Good.
No, it should be fine.
I'm echoing.
I think if anybody has, I'm muted, so it's not me. I think if there's a YouTube page open.
Do I have my YouTube open? No, I don't. Is yours open, Jules? Can you talk?
YouTube is not open.
I think we're good, right?
I think we're lagging badly.
Huh.
Interesting.
Weird.
Does everybody feel like we're lagging? One of you has something open, it says. Echo. Doctora, volume's fine. Can Jules go ahead and speak and see if you're lagging or if I'm lagging?
Okay, I've got everything. See, I can't hear you now. I got everything turned off. Say something, Dr. Latina.
Okay.
I can hear you. I can hear you.
Hold on. Can you hear me now?
I can hear you.
Oh, I hear you.
Yeah, so we're good.
Oh, we are. You sound like you're in the room.
I am. Yeah, I can turn it up louder if you need me to.
No, I'm good. I'm good now. How's everybody in chat doing? You guys sound good now. Good. All good. Bravo. No echo, and it all sounds excellent.
Very nice.
All right. Well, I'm maybe I'm sweating because I'm so excited. I don't know, but I'm having my nose and all that. But I want to introduce you. I'm sure a lot of people already said Jules sent me over, but Jules has a channel called Allegedly Innocent, which, by the way, I forgot to tell you, I used to tune in all the time to you to Allegedly Innocent. No. Jules has
yes.
Of Thought or whatever.
Jules of Thought, yeah.
Yes. And so I lost you. It went away, and I thought, whatever happened to you? And then about 5 months ago, I found you again.
Yeah.
So you changed your name.
Kind of. Yeah. But here's the problem. I think that I was Jules of Thought so long that no one can quit thinking of Jules of Thought, right? Yes. So now I just introduce myself and say, I'm Jules of Thought, and this is Allegedly Innocent.
Right.
So, yeah.
And I think when I put up the invitation for you, I put at Allegedly Innocent, and then it morphed into at Jot.
At JotTube.
Oh, Francesca, thank you so much. This is my moderatrix, I'll say. Francesca is my daughter, and her dog is Mocha. And yes, lovely. Thank you for joining me, Francesca.
Hi, Francesca.
Yeah, so I wanted to tell everybody that I have followed Jules will say, for a couple of years now. And I think when I first went on, I remember you kind of making fun, like, there's some girl that thinks she's a doctor. I don't know. And I was like, I'm here and I follow you. So I know that you have a PhD and that you're a practicing clinician.
I am.
And do I stay in the state of where? State of confusion, state of Texas, state of Michigan? What?
Yeah. So I'm licensed in multiple states.
Okay, there you go.
Yeah. I practice in, I have Colorado, West Virginia, Texas, and there's a consortium with Texas for some other states, but the majority of my work is Texas, although in the coming couple of years, I'll be moving north to the mountains. So.
Of my
Colorado.
Oh, darn. I was saying New England. That's right.
No.
Well, tell us a little something before we dive in. I mean, I listen to you voraciously, and I love your perspective from both a research as well as a clinical point of view. But I would love you to give us a thumbnail sketch about your education and a little bit about your practice history, and then we're going to dive into some themes tonight, aren't we?
Sure, absolutely. I started my adult life as a teacher, and I absolutely loved it, but I wanted to do a little bit more. And so I began collecting other degrees. And so I said, well, why not the PhD? And so it was kind of a funny story because I had a small child when I was pregnant, and I thought, well, I'm going to take 3 years off because I'm a believer in developmental, issues. So I take 3 years off. That lasted about 6 months, drove me crazy. So I got in my PhD program, worked on it while I had an infant at home. Since that time, my research has been on factors related to healing following trauma.
Wonderful.
And so then I work primarily in the medical field, although I do have a private practice. But I do a lot of work with people that have experienced devastating traumatic brain injury, serious burns, like more than 40 to 80% of total body surface burn, lots of adjustment issues, that kind of thing. And you and I are very similar, and that when you're working, there's sometimes you can kind of feel isolated, right?
Yes.
And so the YouTube gave me an opportunity to just make friends and just be one of the group and have fun, and I love true crime. I always have. And when I discovered the true crime community, to be able to talk about these fantastic crimes and the unusual live trials and that kind of thing, I just felt like, I found my people. so that's how I kind of jumped from clinical work over, now I've got this what I call a hobby channel.
Yes.
To talk about forensics, and that's what I do.
That's wonderful. Now, how long have you had the YouTube channel?
Chris Watts was the jumping off point for me, but I haven't really been consistent with the channel because I do work about 50 hours a week. Wow. So my weekends are my YouTube time. Sometimes I do YouTube during the middle of the week if I get some extra time, but primarily, it's a weekend kind of thing. I wish I could do it full time, but not yet. One day I'll get fully retired and then I'll be able to, but not now.
Right. But I think in the meantime, something that I really enjoy, Jules, is, and I'm sure it resonates with you, is the idea that instead of maybe reaching, well, in family medicine, I might have seen 22 to 28 patients a day, too much. And in the psychiatry, psychology, I might see 6 patients, let's say, a day. But with YouTube, I have an opportunity to say some things that might touch 1,000 people or 2,000, yes, to be able to offer some insight, offer some advice, so I agree with you. The affiliation on a personal level that has nothing to do with my profession is wonderful on YouTube.
Yeah.
But it's also nice to feel that I have an opportunity to share knowledge and experience and maybe it'll help somebody along the way.
Yeah,
what do you
absolutely. Think? Well, I had a lot of people in the very beginning when it kind of began to come out that, you know, that I am a clinical psychologist. I had people say, don't you know how much good you could do if you did a channel related to your field? And I said, yeah, but the whole reason I really enjoy my channel is because it's different from my field. And
that too, yes.
You know, I do agree. And I do watch like Dr. Grande and, you know, the other big person, you know, mental health personalities on YouTube. But I enjoy having the outlet for the forensic information, and that's really kind of my thing. I don't think I'm still at that point of turning my channel into an extension of my career.
I don't think you're like compartmentalization.
I think so. Yeah, I do. I think that's my comfort zone. I like it, you know, and gives me. It's a bit of a mental health tool for me to get away from some of the more difficult, you know, hospital work. So
yeah, I could imagine. I could definitely imagine. I mean, I think it is important for me anyway, as well, probably for you. Just if you can put it down in here. I have my other daughter, Dorsey Camila, now, who is helping to jerry-rig some infographics around psychopathy and sociopathy, and some graphics around the Tetrad, the Triad, and that kind of thing, so that we can show a few, like maybe it'll help us to make our talking points. Do you know what I mean?
I do. Yeah, that's a great idea.
Yeah. Now, the thing that I was going to mention, and I want to sort of remind folks in the chat here who may or may not know me, may or may not know you, that I am not a forensic physician, forensic pathologist, forensic psychologist. This forensics or legal true crime piece really is a hobby, right, for me. So I try to offer impressions and perspectives based on my professional and personal experience in life, but I'm not at all offering a forensic perspective per se. And also, as you, I don't think we can clearly, and we certainly don't want to diagnose, let's say in this case, Bryan Kohberger, because neither you nor I has met him, nor you or I, neither of us has evaluated him.
Correct.
So when we speak tonight on issues around criminal behavior or psychopathy, sociopathy, or trauma even, todo eso, esto, okay, un momento. Sorry, guys, this one, sorry, and the Dark Triad. Okay, I think that we need to remind folks that we're talking in generalities, in patterns of behavior, and that we certainly aren't here to disrespect anybody, nor to diagnose. What do you all think? What do you think, Jules? About that?
I agree. Yeah, I agree. And I do think that there's a lot of confusion about this idea of what is a diagnosis officially. What is a diagnosis? And both you and I have these restrictions of you can't give a diagnosis without a proper interview and evaluation of the patient. But to be online and talk about some of these situations that are unfolding with people that have either been convicted of crimes, or they're standing trial, or they're the focus of an investigation, it's not that you're diagnosing those people. You can't diagnose them. You don't know them, and you have never asked them a single question or looked at their background and history. The best that you can do is sort of gather some data points that have been printed in newspapers or you know, by the actors themselves, videos or whatnot, and have a discussion about what it might be or what it's similar to, but no, you're not making a formal diagnosis.
Right. And then I think that, you know, as I have known you for, quote, quote, we've been virtual friends for at least a year or so.
We have.
Yes. I think that it's important for me to say that you have a dry wit. You are hilarious with your singing and all of this. And sometimes you even have gallows humor, as do I, meaning in the face of evil or in the face of a horrific situation, we can laugh, we can be silly. You could even put up a silly song. And that certainly, knowing you, does not ever mean that you think something's truly funny, but really it's a way of almost like a relief valve. And I also know you to be a person of integrity and compassion. And I myself try to be. And if I make a mistake around coming across sort of without integrity or with not being kind, without kindness, that is never done with intentionality. And I just wanted to remind folks that the things that we say here tonight are, I think, done with great intentionality, you and I, and have been done with conversations over a period of years publicly, and more recently behind the scenes privately. So I think, what are your thoughts on that?
I couldn't agree more. I think one of the topics, maybe a criticism that I've received in the past, is sometimes I'll take these accused killers or people that are standing trial, and I'll kind of give them like a funny name, but that's to take the monster, to remove the fear from them, because they've used that fear to take control of somebody's thoughts and emotions and life. And if you yourself or someone who's dealing with a past trauma, it can be kind of scary to immerse yourself in some of these stories. So finding the humor in a lot of ways can be actually therapeutic. So that's why I do it. It's not because I'm diminishing the trauma that the victims experience. It's the exact opposite. It's taking back control away from the monster.
And I have always understood that, because I can be that way as well. But I just wanted to kind of make a disclaimer, so to speak, that, you know, sometimes we may come across as a bit crass or whatever, and it is certainly not meant to be, cruel.
Agreed. Yep. Yeah. Absolutely. Absolutely.
The other thing I wanted to talk before we sort of dive in and into our discussion tonight is, what are your thoughts around the true crime genre on YouTube, and it being for people that are hobbyists, or let's call them armchair sleuths like us, so to speak, or let's say lay people, not forensic people, versus people on YouTube that are, have decades in true crime or police or whatever. What are your thoughts about people being allowed to come to this table for discussion, if we're just hobbyists, let's say?
Well, I am a big believer in freedom of speech. And I also, as a psychologist, I recognize what normal human behavior is. And the reality is that people have been gathering around the water cooler for decades discussing true crime. I can remember my grandmother 50 years ago, there were these magazines that were called something like True Crime, and they were True Crime Detective or something like that. And I remember that I found, a stack of them like in this drawer that she had hidden. And she was like, no, you can't read those. It's about death. But I mean, this would have put her back in the 40s and 50s reading these magazines. So human beings have a fascination with aberrant or abnormal personality that gets expressed in sometimes violent ways. Mm-hmm. So I think that we should have a place at the table. People want to have time to process this information and talk about it, and how does it affect people. I know with the one of the missing women and the case against the person charged got thrown out in Colorado.
Oh yeah.
Yeah. So, that was actually a case that really, really was near and dear to me, because I'm an activist in terms of domestic violence. Mm-hmm. And it was such a stereotypical response, you know, the rich man, the guy around town, people want to protect him. And yet you've got a real woman who's just disappeared into thin air and nobody's thinking about, well, where is she? So it you know, some of these cases do hit home, and yeah, I think it's a great outlet for everybody to gather, whether you have a rich history in law enforcement or whether you know, I do evaluations, and I've testified for things related to the foster care system. I've done some custody evaluations. So I've been a fact witness for some, but yeah, I mean,
you do have experience in forensics in that sense.
I do, just not, I haven't, I don't do, well, I did about 6 months. I was doing, psychological evaluations for incarcerated prisoners. So I was doing that as part of my training, but it's not what I've elected to do in my day-to-day life.
Gotcha.
So
hold on.
Go ahead.
No, I have to ask my daughter a question. Right?
Yeah.
Can you tell me when I want to add an infographic for Miss Jules, and I don't want to add them all at once, but if she's going to have a talking point, how do I know which one to add?
Hold on.
All
right. I'm back.
Welcome back. I hope I answered your question.
You did.
I wasn't really prepared for that answer.
No, I know that was a hardball question in the sense that I kind of put you on the spot. But I think that, I think I would agree with you. Everybody should have agency and should have an opportunity to express themselves. In our country, anyway, we have free speech. I know a lot don't. I know you lived in Egypt at one point. You've talked about that for many years. You lived, and it's very different. But and
you've got to remember too, these investigative teams, they're multidisciplinary teams. It's not all police. I mean, there are different professions that are working to try to uncover truth.
Right. Well, how would you like to, somebody said they can't hear. I put, Misha Renee, I put myself on mute while my daughter was explaining something. How would you like to proceed with some of tonight's themes? I had mentioned.
I'm going to let you guide it. If you want to go through your 4 bullet points, that's up to you.
Okay.
Will that work?
Yes. I mean, I'm going to try my hardest to put down like an infographic and then have you, I think it'll come up on the screen, I think, and then you can speak on it. So I think the general theme tonight is, we are discussing the recent arrest of Bryan Kohberger, who's a 28-year-old male out of Albrightsville / Scranton, Pennsylvania, PhD graduate student in criminology at the Washington State University, and has been arrested as the primary suspect for the quadruple murder in Idaho of the 4 students. And part of what we're going to do is to try to understand a little bit more about criminal behavior, mental health issues, trauma issues around mental health. There's even something that's come out regarding, right from him as well, from an antiquated internet posts that he did in high school regarding his ocular migraines and something called visual snow. So we're going to try to take some of the information that we've gathered, not only from the press, but from Bryan Kohberger himself, and try to kind of unpack it and hopefully have you explain a little bit about antisocial personality versus psychopathy versus sociopathy. Is there a fate? And my question is, and I'm taking this directly from your recent live, which is the face of evil. I call it the face of evil. But is there really a face of evil is the question? Or are there stigmata, I'm going to say, of features in a person's face that can point to certain either traits of psychopathy or true psychopathy or antisocial or sociopathy. So I'm going to throw out tonight, and that's the question we're going to talk about first, is there a face of evil? And I'm going to ask you to kind of start in, and I could put a little infographic up about psychopathy or how it's like.
Did you put up like the diagnostic criteria or?
No, I did more general because I thought, I don't know if we want to get way into the grain or the granulars.
There's no reason to do the whole diagnostic
DSM-5 thing. No, but I do think it's important because I try to repeat this fairly frequently because people really do have a misunderstanding or a misconception of what is the difference between the person's nuts or they're crazy or they have a mental illness versus a person might have a personality disorder versus they have traits of having a personality disorder. I do think it's important if you could just kind of, without getting into the granular pieces of, let's say, what is narcissism or what is this, would you mind telling us what is the difference in your mind and your professional understanding of being, quote, nuts, having right?
Well, I often talk about things being nuts or crazy just as a person, but never would I call somebody crazy, no. My work setting, right?
No.
Go ahead.
Sorry. No, I would just say one thing. I have heard both on different YouTube channels as well as in the media, people saying, well, he was crazy or she was insane. And people throw around these terms. And I think it's dangerous because we first of all, what does that even mean versus have we evaluated the person? So I thought maybe first you could maybe talk a little bit about what is mental illness in general versus, let's say, a personality disorder and that kind of thing.
Okay. So I would, because you're the physician, I'd like you to talk about the physiological foundation to true mental illness, like schizophrenia, bipolar, and that kind of thing. But basically, when you're talking about a mental illness or you're talking about a psychiatric disorder, you kind of have a choice. This is really general, but you kind of have a choice between, are we really looking at a real physiological response? And in that case, if there's something organic that's happening within the brain and the body that is prompting a severe, an unusual behavior change or an altered mental status, that kind of thing. The second choice is that it's really more of a personality disorder. Personality disorder is just long-standing pattern of behavior that is not likely to change without a whole lot of hard work, really. And for personality disorders to actually, we all have personality. We all have these, we have different models of personality. One is the Big Five model of personality. One is the 16 PF. But basically we all have these descriptors, these factors to describe what we are. Like, are you high in agreeableness? Do you try to get along with others? Or are you very low in agreeableness? Are you high in neuroticism? How are you in terms of extroversion? Got a lot of extroversion or a little bit of extroversion? And then the fifth factor is conscientiousness, which is, you take care of your responsibilities and you stay organized and take care of things. And so our personality can be any constellation of those five factors. So we all have some neuroticism. We can all be on the narcissistic side. But in order to actually classify that for it to meet the level of disorder, a narcissistic personality disorder or an antisocial personality disorder, the symptoms the behaviors that you're exhibiting have to be enough that they're interfering with your effective functioning in two or more domains. So
more.
So there's a little bit lax on that, but really, from my old training, we were looking for disruption in 2 domains. So is it vocational and personal? You know, you had some choice, you had some leeway there. But it does have to be it can't just be that you're annoying because you have a lot of narcissism. It has to really interfere with some level of functioning for it to rise to that level of disorder. Symptoms have to be apparent by a specific age. It has to, you know, there's a lot of rule outs and things like that. But for this discussion in the true crime community, we're generally always at odds with each other about, is this psychopathy or is this sociopathy? And they're actually 2 different things, even though they sound similar. But they're both housed under this umbrella of antisocial personality disorder. And if you were to look at the DSM-5 and you looked up the diagnostic criteria for antisocial personality disorder, you would see some of the characteristics for both psychopathy as well as sociopathy. And so it would be things like lying, using aliases, not owning your own identity, but using aliases in the commission of a crime, conning other people for profit, or intentionally setting somebody up and then finding pleasure out of it just because you like to see someone get hurt. Mm-hmm. Now that leads us to the discrimination between, are you talking about sociopathy or are you talking about psychopathy? Or
I haven't heard it. Do you see my infograph? I don't know if it's up there.
I'm not looking at that. Sorry. Oh, okay. Okay. So in general, I
don't know if that's a helpful infographic.
Yeah, no, that's it. That is. And so for sociopathy would be that person that would actually do something hurtful and then get joy or pleasure from hurting someone. Mm-hmm. So this is where you see sadism and masochism and the philias and that kind of thing. Psychopathy is actually more of like a brain-based problem, they believe. The new contemporary research is really conceptualizing it as a neurological dysfunction. Yeah. And it's basically the limbic system is not providing corrective emotion. And so people can do things and they don't seem to be affected by guilt or sadness or shame. So they're capable of doing things that are fairly horrible or in general just socially unacceptable behavior. And they don't ever change, because why would they? They very often have a high level of Machiavellianism where they believe that other people are there to support them in getting their needs met. And so if you hurt somebody on your way to your goal attainment, that was their reason for being here, was to help you, the psychopath.
Right. So people that are sort of collaterally hurt are just seen as stepping stones to that person's goal, is kind of what you're saying.
Absolutely. Yeah. Okay. So lacks empathy and guilt. I'm going to talk about that in a second. Higher job success, maybe sociopaths, environmentally influenced, feel empathy and guilt. They have erratic behavior, struggles to find and keep jobs. Psychopaths too can be quite impulsive. There's
overlap.
Pardon?
I said there is overlap.
Yes. So psychopaths too can be very impulsive because you have to think about they're being primarily driven by basic instincts and needs. They think about something they want and then they just get it. And they don't get lost in all of the worry about, well, is this fair? Am I going to hurt somebody's feelings? Am I going to take somebody else's job? They don't think about it. And so one of the reasons why people find it hard to distinguish between psychopathy and sociopathy under that umbrella of antisocial personality disorder is because they're both they both are mercenary, right?
Mm-hmm.
That they're willing to use other people to get the things that they desire. So
there's a question that I want to put up on the on the screen, if you might go there, from Thomas.
Okay, so talk about it in what way?
Well, I'm wondering if Thomas is questioning him. I think that, as you said, the contemporary literature, the studies are beginning to show that psychopathy, I mean, both are antisocial personality, right, disorder, psychopathy and sociopathy, but there's more of a genetic basis for psychopathy, that people, there is a belief now that people are born, frankly, as a psychopath.
Yeah, it could be primary, as in that there's a causative agent or event, or it can be, I'm sorry, I said that backwards. It can be something that they're born with, or there could be a causative event. There could be a brain injury, something like that.
But I think with psychopathy, there is a genetic basis the more we're studying this. But as you said earlier, there is a neurophysiologic foundation with psychopathy. However, I think, tell me if I'm wrong, or you agree or disagree, that with just because somebody is a psychopath, for instance, does not mean that they're going to become a serial killer.
No way. No.
There are a lot of people out there that are psychopaths.
Yes.
Or I don't even want to name names, but famous people can be psychopaths, and they're utterly charming, and they get what they get, and they don't get upset.
Yeah, absolutely.
But they're not killing people, right?
That's right.
What are your thoughts on that?
That is where the Dark Triad research came from. Is this study of antisocial versus psychopathy in people that are really successful, like your high-level politicians and such, or Fortune 500 CEOs. And that's where they broke down this graphic that you've got with the bad boy in the middle, and you've got narcissism, Machiavellianism, and
this one.
I don't see anything.
Okay, I put that up just now. Do you see it?
I don't. Let me look, see what's going on here. Okay, so this was developed to discuss these people who are not killers, they're not serial killers, but they are fairly mercenary in like climbing the ladder of fortune and fame, and not being too concerned about who they hurt. You know, it's all worth it if it's for them and whatever their particular goal happens to be. The difference between the psychopath, though, who's kind of climbing that ladder to fortune and fame, there just isn't that same level of joy or excitement or feelings of victory that you get like when it's somebody who's antisocial, where there's sociopathy. There's something else going on there. It's a quest for fame, or it's a quest for money. But your psychopath, it could just be they really like the work they do, and that's what's motivating them 100%. And that if it's something that they think they should do, then they'll do it with no regard to hurting someone, as opposed to sociopathy, where someone is, you know, I can't wait to get rich so I can stick it to them and, you know, make them get vengeance for the things that they did to hurt me. So, so the psychopath, somebody who we actually say someone who scores high in psychopathy, they're very functional, right? The things that drive them are things that they view as survival. In some ways, you could look at Scrooge as the ultimate psychopath. Mm-hmm. Now, he wasn't technically, because earlier he had some relationships and felt love and all that. But toward the end, for him, he worked hard, he saved every dime, but there was no joy. Like none of it was done for any reason other than it's just what I do and I'll keep doing it. So it kind of gives you that idea.
Very nuanced in a way.
It is nuanced, except you with the psychopathy, you cannot forget that their brain, their limbic system is actually different than mine and yours. They're really not wired for positive, it really any type of real positive emotion.
With the psychopath.
With people that score high in psychopathy.
Mm-hmm.
So when you ask that question about the face of evil, I tend more to look at sociopathy. Those people scare me a bit more because they're having fun if they're hurting you. Like they like it, right? So that, to me, that's kind of your stereotypical monster in Hollywood, right? But with psychopathy, asking about the face of evil, is there such a thing? Initially you'd say, of course, no. Your bone structure shouldn't really have any influence on your actual appearance. However, there are two features that are connected to people that score high in psychopathy that can certainly give you a level of discomfort when you're around them. And
do you have that graphic? I'm sorry to interrupt you. I know you showed it on your live recently, but
the what?
On your recent live, you had some graphics to talk about some of the stigmata. I call them stigmata, facial stigmata of the psychopath. Do you happen to have?
No, I didn't do those because I didn't know that we were going to go really that far in depth.
Sorry.
But no, that's okay. But just that kind of, what are the two features that can really affect how the person high in psychopathy their physical appearance? What can it do? If you want to, let me show you, Amy. Let me pull up. I don't want to lose that graphic. Hold on. Let me pull up this one graphic and then you can share it. And that'll give you something new to do. Learn.
Oh, okay.
Oh, I think I deleted it. And why don't you talk about the medications related to the whole visual snow thing?
Oh, yes. Well, I'll just sort of introduce the idea here. I don't know even if folks have followed some of the recent news or Jules' channel. And I think also Nerdy Addict did a very rather deep dive on the whole concept of, in this case, Bryan Kohberger and his history from probably from mid-high school, of having what we call ocular migraines or eye migraines. And then sort of a part or a subtype of ocular migraines can be something called visual snow, which is, and I may even have, I don't know how to get it up. I don't know if my daughter actually put it. Let me just see if she did the visual snow. Well, these are some graphics of where the visual snow happens. I don't think here. What and there's something called visual snow, and then I'll explain that in a minute. But then even more chronic is something called visual snow syndrome. And I'm going to put some links to some organizations and some articles that folks can look back to. At the end of this live, I'll go and put it in my comment section or the posting section, the about description section. But visual snow is a phenomenon that is not well understood. It is rather rare. It's maybe 1 to 2% of the population, and it's considered to be something pathological that occurs in the visual area of the brain, which I have some graphics for folks as well. But what it causes, if everybody wants to look at this graphic that I put up is normal sight is what you and I might see. And then sight with visual snow looks kind of quite granular. You had something?
No, I just deleted something that I wanted.
Oh,
Sorry.
no.
Go ahead. It's okay. Go ahead.
No, and so I don't know where we're going with the visual snow and the visual snow syndrome, except that we do not know what causes this syndrome, and or sometimes it's just a passing phenomenon where a person's vision, and it's not like having just intermittent floaters in your eyesight, but it takes the entire visual field and it looks granular, grainy, and somewhat snow-like. And in some, and it has been well sort of unpacked and verified as to best they can, but on the channel called Nerdy Addict, he's a very sophisticated IT guy, as is his partner Sleuthy girl. And they were able to go back and find what they believe really is a verified internet postings of Bryan Kohberger back when he was 15, 16, 17, talking about his experience with something called visual snow and how this was really debilitating for him, that he was being treated as if it's having ocular migraine type of thing. And he was feeling, and if you follow some of his postings, he was feeling extremely despondent about these symptoms. Again, we don't know what triggers it. And it isn't just the granular snow, but there are 4 or 5 other effects that happen in your visual system that can occur if you actually have the syndrome. And, if you look on the internet, even amongst the scholarly articles, even in 2022, well, just speaking 2023, nothing's really come out yet, but, the jury really is still out. What causes this visual snow? Can illicit drug use cause this? Is visual snow akin to, or is it a separate phenomenon from what they call post-hallucinogenic or illicit drugs in the hallucinogen class of drugs syndrome, which people who abuse certain types of street drugs actually can get something akin to visual snow. Some thoughts are that visual snow can be triggered by use, and it could just be on a one-time basis. Some of the literature say that actually Zoloft and the serotonin uptake inhibitors, some of the stimulant meds that we use for attention deficit disorder, there are case reports where those classes of meds are thought to trigger visual snow syndrome. But go ahead.
Did you read the articles that were talking about the ecstasy and MDMA influence?
Yes.
Yeah. So
go ahead.
No, you're fine. Go ahead.
No, I think I sent you some, and I don't know if you had others, but that there is the MDMA, the ecstasy, amongst other illicit drugs, act obviously on the brain. The visual cortex, really the primary and secondary visual cortex is in the back of the brain, generally, like whereas marijuana, for instance, and we even know has long-term and short-term effects, but that's generally on the frontal lobe. And heroin, which we think we know that Bryan Kohberger had an addiction to, definitely we know that can cause changes in the frontal cortex, which have to do with disinhibition of your behaviors, a poor filter of your behaviors, impulse control. Those kind of things can be affected, usually reversible, by chronic and or short-term use of heroin or cannabinoids or marijuana. It's less understood what the effect of marijuana, heroin, and the MDMA and the other, what was the other one that you said?
Ecstasy was statistically significantly more likely to result in the first appearance of the visual snow than the other drugs.
Yes. So the question then begs, and that Gemma has this question up here, which we'll talk about in a minute. But in Bryan's, it was almost like a blog in a way, right? You talk to that a bit, but there seemed to be an association, and I don't blame people if they're having visual problems like this. Poor night vision is associated with visual snow syndrome, photophobia, which is very high sensitivity to sunlight or even ambient light or any kind of light. So it can very much impact on a person. And I can imagine if you're a teenager and let's say he's 28 now, this is when he was 15, 13 years ago, I don't think this was well understood. We don't even understand it now, let alone 13 years ago very well. I can imagine it could be very isolating. It could be frightening. And Gemma McDonald asks here, would that cause symptoms of suicidal ideation, poor self-worth, depersonalization? Yes, I could imagine, because it's frightening, especially if you're an adolescent.
Yeah.
And you need to get not only neurologic help, but psychological help for this.
Right. So diagnostically, this only affects 2.2% of the population, and they have to have the symptoms for 3 months, and there has to be multiple visual disruption. It can be palinopsia, where you like when you look in a certain direction, the timing on your eyesight is off, and so you get like this trail of the object. Mm-hmm. So that's palinopsia. Also floaters, photopsia. You talked about, I think I heard you say
photophobia. This very sensitivity to light.
Yep.
And the not night blindness, but almost very poor night vision.
Yeah. Nyctalopia, I think. Nyctalopia. But the person is not really going to get that diagnosis unless they have multiple disruption, phenomenon. So you can imagine. So I don't know, will it let me share, or I can put a website, it will let me share.
Okay. So I think the way you do, because the other night when Tyler was on with you, he somehow was able to pop in his infograph right into the studio, and then I put it up. It was very mysterious to me.
I think I see it. Hold on.
Maybe under share or something. I don't know.
Yeah. Okay. So this is a graphic that shows the different types of visual phenomenon that you can experience if you're having visual snow or visual snow syndrome.
Did you just put that up, or did I have to click?
I put it up. I think you have to click it to make it go there. Okay, it should be up there now. Can y'all see the yellow turtle crossing sign?
Okay. Yes. Wonderful.
Okay. So again, just to kind of develop an appreciation for how uncomfortable this condition actually is, you can have visual snow, which is one of these images that they've shown you, or in order to get diagnosed with the visual snow syndrome, then you have to have 3 of these phenomenon. So the first picture that you see, that's normal vision. That's A, is normal vision. The B is an example of just kind of basic visual snow, like by itself. But when you get down to C, that is palinopsia.
Okay, we can't see that. I'm sorry. You must have scrolled down, or did I do that? I don't know. I just see words right now.
Oh, okay. I went down the wrong one. Here we go. There you go. I thought I gave you a regular
infograph.
Yeah. Okay. So palinopsia is down on C, and that's where you kind of get that staggered visual, right? The timing is off on your visual ocular memory. And so you keep the memory too long. And so it gives you that staggered kind of floating. But But then if you, the D is the photo orbs and that kind of thing. But then to get actual visual snow diagnosis syndrome, that's a top right-hand picture that is so much disruption happening in the field of vision.
Like simultaneously.
At the same time. And in order for it to be visual snow syndrome, it's the full field of vision.
That's right.
Now, there are some people that will have like a partial field of vision, but they don't typically get the full 3 or more phenomenon. But if you're diagnosed with visual snow syndrome, it's very powerful.
Mm-hmm. And we don't really know. I don't anyway. I guess I didn't read deeply enough into Bryan Kohberger's descriptives on his posting. But did you read what he described at all?
Yeah. So he claims in his writings that he's experiencing all of the symptoms. Okay. So he says that, and he does talk with some passive suicidal ideation, that life's not worth living, that the constant onslaught of visual stimulation has resulted in him feeling desensitized, that sensory-wise he doesn't feel connected. Having a feeling of derealization or depersonalization is an additional diagnostic that can go along with this visual snow phenomenon. So we don't know Bryan. We hadn't had the opportunity to question him and explore his background and history. But when you go through and you read these postings that he left, he clearly was experiencing a great deal of frustration and resentment about not having anything. He even was saying goodbye to his house. As if it were, a person. I mean, we are personally connected to our homes, but so, part of me wonders when I go through and I read these postings, part of me wonders, are we in fact really seeing him write about the impact of this, what could legitimately be a really severe condition? Is he just exhausted from it? Is he just worn out? Or was he demonstrating some kind of, maybe some sort of conversion problem, being lonely, not really having a friend group, an identity, and he was expressing those needs or the fact that they're not being, that he's being stunted in terms of his developmental trajectory. Is he expressing that more as having like a medical issue? It would be very interesting to know now if he continues to have this, because it doesn't really go away. At least that's what the literature looks like to me.
Right. And I think I just wanted to, Janet has just asked a question. How would somebody be legally able to drive? Honestly, they're for sure for nighttime, not. And,
Right.
They're really not supposed to be driving if you have this. Can you imagine? I wanted you to go back to C there on your infograph, where you see a trail, because there's a lag in what you see versus what your brain is, able to remember or does remember, and there's a slowness. How could you make good judgment vis-a-vis driving and stopping,
Right.
etc.? So you're not supposed to, and this is why I think we need more elucidation on, was this a real thing? Because if it were a real thing for him, then you're fast forwarding to age 28. The person's driving 2,000 miles across the country. How could this person have been able to get as far as they got if it's that incapacitating?
And can you imagine, with all of the reading, all of the typing, how would he do that? How would he accomplish that if he's having this much obstruction visually? I just can't imagine being in a graduate class and doing that work without being able to see.
I agree. And I think that's why we were saying earlier in our chat that you and I don't have enough information. And honestly, I don't think anybody does at this point, including the defense or the state, because he needs and he deserves a full battery of psychological, psychiatric, and neuropsychiatric testing, and maybe even imaging the brain, etc. But I would say there was something now. From a clinical experience, I can tell you that adolescence because of the radical changes in hormonal levels and the effect that hormones have on the brain. You see a lot of transitory or fleeting things that happen, or they aren't fleeting, but a lot of times especially, let's say in girls, right at the time of menarche or the first period, you can see the first psychotic depression. Yeah. You can see so many neuropsychiatric disorders can emerge in adolescence. And then closer to 18 to 25, let's say, and it may or may not be genetic. With schizophrenia, certainly there's a genetic component, but illicit drug use I've seen it so many times in young men that they didn't even know they had a family history of schizophrenia or some sort of a chronic psychotic problem, bipolar. They dabble in illicit drugs, and it unmasks a psychosis. And I've seen, sadly, some people never come back from it. That's the scary thing. But what I have seen quite a bit in adolescence is in fact, I can think of some patients that have had visual hallucinations that are not drug using. They have no, abnormalities in their neurologic or their MRI, nothing. But certain time of day, certain level of anxiety they get, and suddenly they get true visual hallucinations.
Yeah.
And they're usually fixed. It's a certain type of I'm not going to get too specific because I don't, got to worry about HIPAA, but it's a real phenomenon and it's real for them. But if we drop back and we've worked up all the possible neuropathological roots of a problem, and they have none of those, often it then you go into, well, how are we going to help you with your anxiety so that you're not overwhelmed to the point where you're having some hallucinations. So so touching that and then going into Bryan Kohberger, I don't have the answer, but I don't know, first of all, we don't know what kind of drug use he was dabbling with at the time that this supposed visual snow began. We don't know.
Just the friends commenting, and the dad of one of the friends said that he knew that Bryan had been in and out of rehabs.
But what did that? That's true. Was interviewed, and he said that Bryan was complaining of ocular migraines, and then his friend was I guess at his friend's house. Bryan came over, and the friend made a comment. I heard this on the news. Something like, well, you don't look like you're in pain. And then Bryan apparently got very angry and said, you don't understand and you're stupid or something. So he put the guy down. And what the young man didn't understand was that you can have an ocular migraine and it doesn't necessarily have to be a pain. It can be an aura. It could be vomiting. It could be nausea. But I guess what I'm saying is, I don't know I know he was put on medication apparently for the visual snow, apparently.
Yeah, they will give. So first of all, he admits in one of his writings that he took multiple effective migraine medicines, and that he had 2 episodes where he overdosed on that medication. There's also some reference to Topamax. Is that
That's
right?
That's right.
Okay. And then there's the Topamax to add into, these vasoconstrictors for the migraine. But also, he also references taking Depakote. So I thought, Depakote with Topamax? I don't think that they do that, do they?
Well, I mean, they do a lot of things.
That they maybe shouldn't do.
Right. There can be cocktails of things. The Topamax, which is interesting, just as an aside, is used sometimes. It is sort of an anti-seizure medicine, but I don't generally do, for people who want to deal with weight, to get weight loss.
Yes. Yeah.
So then I'm thinking, see, this is what I'd love to know. What is the sequence for him?
And then isn't it also being used for mood stabilizer?
And it's a mood stabilizer as well.
Yeah.
So then the question begs, and guys, we don't know. I have no answers for this. But then, yeah, I know there were issues and there were photographs around his having an obesity issue. Was the Topamax given for the supposed visual snow, and then he had great weight loss from that? Or was he given the Topamax because he wanted to lose? I don't know. That's I don't know what the question is. Thank you, by the way, for the super chat. That was most kind and unexpected. So, I don't know. We just don't have enough information. I mean, that's really what it comes down to.
Now, I will say that I'm going to put a different graphic up, if that's okay.
Oh, yes, that's fine. I did want to mention something that Marlena Cantu is here. And Marlena, I did send you an email inviting you to become a mod. I don't know if you got that, but I sent it tonight to you. So I added you to, and you have to sort of, I guess you have to sort of say, yes, you want to be, and maybe you don't want to be, but I did add you, Marlena. Okay.
Okay. So there's a graphic up.
Janet, a minute. Okay, graphic. I think I have to press it. I'm going to press it now.
Yes. Okay. So this is Adam Lanza of Sandy Hook. And then this is obviously Bryan Kohberger, the guy that's been arrested for the murder of Kaylee, Maddie, Ethan, and Xana.
I'm sorry, can you be more specific? As we're looking at this photograph, on our right is Bryan. Is that right? And on our left, tell me if I'm right, is Lanza from Sandy Hook.
Correct. Yes. Now then, I have a reason for putting it up. When you're talking about the dark tetrad or the dark triad or narcissism in general, if it rises to level of being a disorder, a personality disorder, then there are some fairly stereotypical mistakes that they make. And for example, one of the things, to have a rare medical condition would give you narcissistic supply if you're a narcissist. If you have narcissistic personality disorder and you find out that you're only part of 2% of the world's population because you have this unusual medical condition, oh my gosh, that would just make you feel great. That would
the visual snow. You're giving that as an example.
Yes.
If you have narcissistic personality disorder, and then you're told you have visual snow, which only 2% of the world has, that would supply you with great ego, with great. Is that what you're saying?
Yes, it would make you feel special. Like I've seen somebody just get over the moon excited because they had red hair and blue eyes, which is a very genetically uncommon combination. So they can latch on to things that other people just look at as interesting. But for them, it can really feed their identity. Like, oh, I'm special because I've got visual snow.
I got you.
Yeah. So reading Bryan's post, there was a lot about not being alone, not having any relationships, not having any friends. Didn't really sound like he was very close with family. And part of me wonders if because on these boards, he's very active, like he's posting all the time, answering people's questions, putting up original postings, things like that. Part of me wondered, was this a replacement for a friendship, for an age appropriate, regular teenage boy friendship that he didn't really have?
Although
go ahead.
No, it did sound like from the few folks that knew him in high school that he would go to people's houses. They would come to his house. So he had a friend group. No?
It was just the the one guy, and then the sister of that guy,
True.
and the dad. They're the three that have come out and spoken. And I think, and I'd like the chat to tell me, do you get the feeling that the guy who's talking about the jogging at late at night, isn't that the sister Casey Ant's brother? Because he talks about breaking off the friendship, and the dad talks about his son breaking off the friendship. I kind of think it's one family that's commenting on this guy.
I think. I don't know, what does the chat think?
Yeah, what do y'all think? Do you think it's all the same? This Casey Arntz, the brother and the dad.
Should we take a poll?
Okay, so let me go ahead here. So part of me wonders if there maybe was, whether you want to call it a narcissistic supply, his developmental needs being frustrated because he couldn't make a connection with other people, like kind of like the whole incel phenomenon that breeds so much anger and contempt. Was there conversion disorder happening where he really was so emotionally distraught that he actually did begin to sort of experience these phenomenons? We do know that there does seem to be a correlation. Correlations aren't the greatest statistic, but there does seem to be a bit of a correlation between people high in psychopathy and the experience of migraines. So I don't know. The answer is I don't know, but more and more it leads me to maybe these were just really early expressions of the same problem that ultimately led him to act out in Idaho like he did. When we talk about the face of evil, you can look at these two faces side by side and you're kind of struck by, oh my gosh, they look the same. They look like the same person. But there's actually two things that you're probably responding to that gives you that feeling. One are the eyes. And we do have research that does support this idea of the psychopathic glare or the psychopathic eyes. It has to do, apparently, empirically, the researchers believe that it has to do with the fact that their eyes stay in a somewhat dilated state. And so they always look really dark. But more importantly, when you're looking at them and they're looking back at you, because their pupils are too big, your brain is not really sure if they're looking at you. There is research that shows that for people high in psychopathy, they actually look at the face very little. They will be looking at your hair, they'll be looking at your Adam's apple, but very rarely are they actually making eye contact. So when you get that sustained, prolonged eye contact that you see between mothers and babies or husbands and wives, children, brothers and sisters, when they're looking at each other and they're making good solid eye contact, their brains are responding with a high level of activity. Like the brain loves that connection. But for people high in psychopathy, you're looking at them thinking you're going to make that connection to their brain, but because they're looking at your nose or they're looking at your chest, you're not really sure they're not looking at you, but you feel that disconnect. You feel that coldness.
And I think that deadpan.
Yes. The second thing that you could be responding here is the problem in affect, right? So the majority of research that's come out, really most of it that I found was really like 2010 back. There was something that was published in 2019, but they basically were looking at 5 emotions. For people that were high in psychopathy, they're using a prison population, and then they had a control group of non-prison, neurotypical, no personality, average level psychopathy. They only included one positive emotion, which was happy. And the other emotions were like sadness, fear, guilt, and anger, and then happiness. Unexpectedly, they found a statistically significant negative correlation between high levels of endorsed psychopathy and happiness. So if they saw somebody that was notably happy, no reaction, or if the person was really happy, they would even feel mildly irritated by that.
All right,
So-
say that again. I'm sorry. Can you say that again, even for me? Tell me again. So you're saying the person is let's say there's a psychopath.
Yes.
And they see a happy.
Let's be exact for the research part because it makes it easier to understand.
Okay.
So they gave instruments that measured levels of psychopathy. There was a negative correlation between people that were high in endorsed psychopathy with an inverse correlation with happiness. So if somebody was high in psychopathy, they were less likely to recognize a happy face.
Recognize. I gotcha.
Yeah.
Gotcha.
But for fear, anger, sadness, guilt, they could see them. That wasn't statistically significant. They could recognize them. However, in order to identify the basic 4 negative emotions, they had to be fairly extreme. Like people high in psychopathy really struggle with sort of just a vague scowl or just a little bit of a disapproving look. They don't see it. It just doesn't register. If they're confronted with somebody who's very angry or they look very fearsome, then they say, oh, okay, well, that's anger, that's fear, but it never makes they don't ever have that sympathetic nervous system response. The heartbeat doesn't go up. There's no change in the heart, blood pressure or anything. So for this whole research project that was done, it became clear at that point that no, there's clearly something different about these people. Just their basic perceptual response is dramatically different than neurotypical people.
Yeah.
And that could be the other thing that we're responding to when we look at Adam Lanza and Bryan Kohberger, that they have such a similar appearance. The same way with Ted Bundy, he kind of has that same look. And Ted Bundy is a really handsome man.
Yeah.
Nobody would look at him and say, oh, there's a face of evil. I mean, a lot of women talked about, oh, he's so handsome, he's so gorgeous. But everybody says he's creepy. Even though he is handsome, he is creepy. There's something weird. So the belief is among the people that work in this field, the belief is that we are having that disconnect because, number one, the dilated pupils, we're not getting that actual eye-to-eye connection. Mm-hmm. And then the second is restricted and blunted affect. They don't recognize other people's emotions. They're certainly not showing emotion. So that's kind of the explanation for the face of evil.
So it really comes down to the blunted affect, because maybe they're incapable of recognizing other people's emotions,
mm-hmm.
and the blank stare and the dilated pupils that gives them sort of an odd and a disconnect really with folks.
Yes.
Now I don't know who, maybe I took this down, maybe my daughter did, I don't know, that Thomas just said something I wanted you to answer, and that now I can't find Thomas. Oh, there, I don't know how that came back up, but it did. Something clearly happened between them. I don't know whom he's talking about, his folks. That's serious. I'm not sure what it is. When Bryan was writing the post, he referred to his life as a game he could or couldn't control. I don't know.
Yeah, I agree.
So what can you explain?
There were some really dark posts that he actually did talk about feeling dissociated. Depersonalization dissociation is one of those factors related to the visual blind snow. So it's all really interesting, but it's complicated.
It is complicated, and I think when I was watching Nerdy Addict, the content creator, and he and his partner were, and I felt the same way. There was a sense of, it's so sad. It's hard not to feel sad. Empathy for the 15-year-old Bryan, right? He was
suffering.
I'm sorry?
He was suffering
and struggling. And it's hard, it almost makes, it made me want to cry. Like, oh my goodness.
Yeah.
Yet and yet they pointed out, and I pointed out, fast forward 13 years, we all, that does not, let's put it this way, fast forward 13 years, his behavior, actions, choices at age 28 cannot be justified by struggles, disappointments, challenges, depression, whatever that happened or continued to happen between 15 and then. So, we can feel empathy for people, and we should. Let's say this young man is guilty of this travesty. Horrible. But it makes still sad. It's sad because there are 4 lost innocent lives, and it's sad that his life is lost in a sense, and he's a lost person. But he still, as Kaylee's dad said, I saw him interviewed recently, he and his wife, the Gonsalveses, said they can forgive Bryan, but he must pay the consequences regardless of forgiveness. And
correct.
I really think that's really, Miss, can the same person have psychopathy and sociopathy? You want to answer that? And then there's something else, Miss Poppy. I want to see if I can save her. Okay.
Yeah. Remember, if you had either one of these types of people come in, if you're working clinically, you're going to use the DSM-5 but because of insurance and treatment and whatnot. But if both of those conditions, sociopathy being antisocial personality disorder and people being high in this psychopathic or psychopathy trait, they're both going to fall under the heading of antisocial personality disorder. We do not have a separate designator for psychopathy other than to talk about it specifically as like a reflection of a brain-based problem that comes out behaviorally, but they both would fall underneath that ASPD. So does that answer your question, Misha? What do you think, Dr. Latino?
Well, I'm watching the chat. There's so many phenomenal questions, and I just wish I could take each one and put it up, and I've lost all of them now practically. I think that it's important for us to remember that these diagnoses, the DSM-5 that Jules is talking about, it is a diagnostic manual where, research and et cetera, population-based research, et cetera, has put together a constellation of findings that can help us to diagnose somebody. However, when you deal with psychopathy versus sociopathy, those are in some ways contrived terms under the umbrella of antisocial personality disorder. So and I'll give you an example in a minute of what I'm going to say. I think people can have whiffs of everything, but I think people can have psychopathy.
Yeah, definitely. Yeah, we can.
They can. It's not like you go, the person's a psychopath, end of story, goodbye, good luck.
Right. Right.
I do believe, and I forget who asked that question, you can go between things in life. So I'm going to give you an example. I initially thought, and I think I'm wrong now, and you're right, Jules, that Bryan, if we're going to, I'm not going to diagnose, but has strong whiffs of psychopathy. I initially said sociopathy, and I'll tell you why. But I'm not saying I'm right, wrong, whatever. We don't even know. But the pieces that would, for me, he has more whiffs of in the sociopathy realm are that he's more of a loner. There's not a whole, I don't see charming. I don't see master manipulation with a twinkle in your eye. So for me, just, in the blink of an eye, I might say, gosh, she smacks a little bit more of having traits of sociopathy rather than psychopathy. But then again, you look at somebody, if somebody's a serial killer or a killer, and they tend to be less impulsive than a sociopath. Psychopaths will have great planning and precision, and
right.
So I guess to answer whoever asked that question a couple of minutes ago, I don't think anybody in life is 100% of 100% of anything. but the idea here is to try to understand sort of patterns.
And remember, with psychopathy, we're talking about primarily disruption to the limbic system, the affective and interpersonal disruption. Whereas with true antisocial personality disorder, you're getting array of behavioral abnormality. Maybe they're having an reactive attachment problem, but in psychopathy, they're talking about the actual emotional experience and feedback. So that's why it's all housed under that ASPD for now. It was, if I remember my research properly, it was broken out for research purposes, because they wanted to be able to talk about people who are doing things from the sadistic joy of what they're doing, as opposed to someone who's just being very mechanical and, well, you're in my way, so I got to kill you and get you out of my way so I can achieve my goal, which is a different problem than someone who's, enjoying, like you said, the plotting and the planning and that kind of thing. Which
is more a psychopathic piece, no? When you're enjoying or no?
So with sociopathy, there is that sadistic element. They are enjoying hurting others. But a psychopath can be absolutely calculating, specific, quite measured and controlled to achieve what they're trying to achieve. But they do have problems being impulsive if they get frustrated. And I kind of wonder if maybe he was being very careful and mindful about plotting out and planning what he wanted to achieve, but then maybe he was drinking or using drugs that night and it got away from him. And he did it before he was really ready,
But I do find it troubling that, based on the affidavit, that there were something like 12 drive-by kind of scoping out things months prior. So clearly there was a measure of planning and a measure of intentionality more than a measure. But I agree with you. My initial feeling when I didn't know anything, and I still don't about him necessarily, was this somehow drug fueled? Was there something, because we know that even alcohol as a drug, it does lower one's inhibitions and and it can. I've seen plenty of drunk people in my life that have literally they have become so disinhibited that that they become fueled by rage or anger or whatever. So I don't know. And I think it will be interesting, because now he has to submit, obviously, to formal DNA buccal swab, but he has to also give hair samples, etc. And it'll be interesting to see in the hair sample what kinds of substances in the past 90 days, let's say, prior, had he been using. And, can that play a part in some of the behaviors and some of the choices? But I do want to make sure that I'm clear by saying, regardless of whether the person, yes, this is Miss Poppy. That's what I wanted, the autistic spectrum behavior. I'm going to talk about that in a minute, and then you could talk about that. But before I do, I wanted to say that, some people are like, well, maybe he was in, he's, even though Idaho does not have not culpable by reason of insanity, they don't have that plea.
No.
Insanity is a legal term. It is not a medical term. Pleading I was insane is a legal phenomenon. It's a legal thing. And, if you really look at, quote, quote, the person is insane, let's say, and I think you talked about this, for instance, that poor woman who killed her 5 children. You talked about this in one of your lives recently. I think she was from Texas.
Andrea Yates.
And she had really, in my estimation, of course, I never diagnosed or saw her diagnose her, but seemed to smack that she'd had a postpartum psychotic disorder. And maybe indeed she's schizophrenic. Who knows? But I think, from what I can glean, if I were going to choose anybody just ad hoc in the conversation of true crime and criminals, she would be somebody that I would probably have said, based on what I know from, the press or whatever, she was not culpable because she was in that moment insane. I don't know what you think of that.
No, I agree 100%. Yeah.
But this Bryan young man, what if Idaho did have a not culpable by reason of insanity plea? I just from what I know so far could tell you it'd be really hard for him.
I agree.
Because he's so high functioning. I mean,
Yep.
You look at Andrea Yates, she wasn't taking a bath, she wasn't washing her hair, she wasn't eating, she was having command hallucination. I mean, you go all the way through all of her activities of daily living and all of her decompensated thought process. That's in one arena of mental illness. And then you look at Bryan, who was able to keep a job teaching 3 classes. He was able to take a PhD program, apply to the police department, supposedly interested in rural crime or whatever, and IT and how that works. And then you look at, even in the moments or the months ahead, the great intentionality of his planning, including procuring a knife. And then even more compelling is at the moment, and this is all based on affidavit, guys, at the time of the crime, for somebody to know right from wrong, which this shows, and consequences, what are they, malfeasance, whatever you want to call it. He knew to turn his phone off for X amount of time.
Go ahead. He knew to turn his phone off, and he knew to wait for that Uber driver to leave.
Right?
He left the circle drive. He waited for Uber to deliver the food and drive, and then he pulled back in. He would not ever, I don't think, be able to get, So I agree with you. That's an excellent point. Yeah.
And so I think when folks, like lay folks, and us as professionals, but in the field of mental health, but we're lay in the sense that we don't have the inside scoop on any of these folks, on these criminals or whatever, or these suspects. But one sort of thing to hang your hat on, so to speak, when you're trying to understand, is the person insane? Are they psychotic? Are they not? Is easy things for you all to look at are, how are the person's ADLs, or activities of daily living? Are they disheveled? Are they unable to care for themselves? Are there, they're unkempt, et cetera, et cetera. And do they have a thought disorder? We don't know, but you can look at hints of whether somebody has a thought disorder, because is the person unable to, like Andrea Yates, just unable to do anything, just sitting outside kind of going, in her trailer park? Or is the person able to hold a job, talk to students, correct papers, get his car changed from Washington to Washington State from the state of Pennsylvania? I mean, all of those are executive function, frontal lobe, showing, high functionality and high ability to plan and to follow through. And all of that, as you just said, would completely bust apart an insanity plea.
Yep.
So, so he started stalking. Yeah. How about that? What do you think about that?
That is one of my biggest takeaways from the affidavit.
Hi, Madeleine.
It just blows me. I was just shocked to see that he moves up there. He's getting ready to start a PhD program. I'm kind of flying under this idea that maybe is technically narcissistic, right? But if that's true, why wasn't he just all built up and full of himself about starting the PhD program? Why wouldn't he? But he wasn't. He immediately started hunting, immediately. And so, I'm kind of thinking, on one hand, are we going to find out that there's a connection between him and one of those kids?
That's what I'm wondering.
Maybe it's a family connection. Maybe it's someone at the college in Pennsylvania that knew about one of the girls, or Ethan, in Idaho. I don't know, but I would never have guessed that a narcissist would, the day they start a PhD program, they're hunting. That was a big shock for me. So I don't know.
My daughter was going to come on at some point in this chat to talk a little bit from a college age student's perspective.
Oh, good.
About some of the risk factors and some of the behavioral things and the things that put people in her age group at risk.
Yeah.
For stalkers, for people from afar that you might never even know that they existed, but they knew you existed. And how does she and how do young people maybe mitigate the risk, but maybe they're not able to in this day of, the internet and social media where everything
Very
is
difficult.
there.
Yeah.
It is very difficult. But I really was curious to see, I don't know if she's still in the chat, if she would be willing to come up or not. I don't know. She's in the stream, but I don't know what that really means. But okay, I'll have to ask her because I really want to get her opinion on some of this.
Yeah, absolutely.
Oh, she said 10:13. What time is it now? Oh, she said, I can come. I'm here. Hi, Francesca. So what do I do, Titi? Do I just put you in?
Oh, there she is.
Okay, I don't think come on. Hello.
Can you hear me?
I can. Can you speak a little hot and say hello to Miss Jules?
Hi.
Hi, how are you?
Hi. I'm great, Francesca. It's nice to meet you.
Good, nice to meet you too.
So what do you think of all this?
Oh my god, there are a lot of thoughts I think about this case. I think in general, I mean, I know it's all over, and because I think especially since it has to do with college kids, like it's all over the social media, TikTok, like I think it's definitely one of the bigger cases that's gotten, I think, a lot of attention recently.
Yeah,
and rightfully so. I mean, it's horrific. Let's see. What were our questions?
Really, the issue, Francesca, that you had spoken briefly to me earlier about was the issue of the social media. How did it work when you went to college, getting an apartment, and people knowing where you or your friends lived, what the floor plan was, the confessional society that we live in on social media, etc. Do you want to talk a little bit about that and about what you've seen on TikTok recently about this case, etc.? I don't want to guide you too much.
No. So I guess, I mean, you and I, my mother, have talked about this case a lot. And I've also listened to just a bunch of other true crime YouTubers that you've listened to as well, kind of discuss this case. And I think, I mean, I guess the first big thing to touch on, I think that I think you might have touched on your last live. I'm not entirely sure, but you mentioned the floor planning and how, so like obviously different colleges do it differently. For example, where I went, we were not allowed to live on off-campus housing. The school had invested so much money in building like dorms and stuff. We were never allowed to, they didn't allow us to do that. So we always had to live in housing that was like affiliated with my college. So, and I know obviously their college did it a little bit differently, and ours was very, very odd in the sense that they did that. But I think, like, again, all this stuff comes to prevention. So, like, obviously, since this guy found their floor plans through looking online, just like on a rental thing, I mean, like, I hopefully this case kind of encourages colleges and those people also who are renting out to college students or who know that they're renting out to college students to keep those plans kind of protected. The way our college did is even like, I didn't know the floor plans of anybody's house that I didn't live in. Nor was I.
Sorry, Titi. Sorry to interrupt you, but in the chat they're saying, is there a way to put up your audio a bit?
Is there a way to put up my audio?
Your volume.
Well, that's a good question.
Well, maybe speak a little.
All right, I'll speak a little louder, maybe. I guess. Where was I? Oh, the floor plan. I guess, like, at my college, the way we did it is, we were not allowed to access any floor plan for any of college house that was affiliated with us until we went to our lottery system, where students were allowed to get or apply for a house or an apartment or whatever you were trying to get. So we were never and then access was revoked once the lottery, everyone had kind of gotten all their arrangements. That access was revoked and then opened up again once we were going into that system. And obviously, if for off-campus housing, that could be different. But maybe hopefully this case would encourage those who are renting out to college students to keep those a little more protected nowadays, or find a way, because I mean there are ways to protect it. I think it's just about not putting everything out on the internet. Obviously, if house has been sold and stuff, like they're going to have that kind of stuff, but I think maybe this will encourage people to take steps to protect that. As far as someone I just saw think how safe did I feel as a woman on a college campus. So I went to a smaller liberal arts college. Now I had friends who went to, you know, Big Ten state schools, you know, everywhere on the spectrum. And I think, at least for me in my environment, since our campus was smaller, it was everyone kind of knew everybody, or there were a lot of, I think, safety measures for my college in particular to be safe. I personally never felt unsafe on campus. You know, those little they have like these alarms all over campus with the big blue lights that were everywhere. My campus was also very unique in the sense that, again, it was very small, but we also had then our own, instead, not just a campus safety, but our own campus police. So they were part of the city that where my college was. They were part of that police force, but they had their own like small
precinct
on the campus. And actually, the dorm I lived in my freshman year was like right under or above that precinct. Also, the first thing in orientation, they said take down public safety's number. If you ever feel like you're unsafe, or you're leaving the library late at night because one of them closed super late, like 2, 3 in the morning, if you want someone to escort you home, or you want someone to drive you to your off-campus location, give them a ring and they will drive you home. So I think my college did a fairly good job of trying to do as best they could. Obviously, college kids are college kids, and
yes,
you know, where there's a will, there's a way. I mean, I don't know personally. I didn't lock my doors while I was there. In my dorms, they automatically locked. We kind of had a house. We had a 2 apartment house, so people were kind of coming in and out every day. The only thing is, maybe this was a little different, but I mean, no one who didn't live in our house or wasn't invited was never like allowed to be in our house. I think that was just our rules personally, but we didn't like people coming in and out of our house that we didn't know and or invite, kind of thing. I do know that a friend of mine, her apartment, they all pretty much a lot of people left their doors unlocked, but she left her door unlocked one time, and her roommate was sleeping, and they had left money. I guess, you know, I don't know. They came back from their job and they left money on the counter. It's a couple $100, a little stupid, but someone just opened their door, came and took the 100 or couple hundred and left, and then they started locking their doors because things like, you know, but no, everyone was fine, but like thefts did happen, so that's why they did encourage us that. I think college it's a tricky time because you have kids that, some of them, it's their first time being away from home. They don't have that they don't have their parents watching over them, so it's kind of like, oh my god, I don't have to listen to mom and dad, and I don't have to, you know, I kind of get to do my own thing, and like, I'll be honest, there's a lot of peer pressure in college. I mean, I saw more drugs there than I've seen any other time. Like, outside of college, I've never seen, like, you don't see drugs in my day-to-day life. I've seen many drugs in person at college. I think there is a whole lot of peer pressure. I mean, I'm not going to toot my own horn, but I mean, that's not really my thing. I don't really, you know, that's, you know, a little bit of drinking was the most I think I ever really did, but so that really wasn't my thing. But I mean, the peer pressure is there. I mean, I'm not gonna lie. I mean, I drank underage, but so did every single freshman that I know. You know? So yeah. And so those things are there. And again, I did it. I'm not gonna be the one to say don't do that. That's bad. You know, I think you have to know who you're friends with. You know who you can trust. You know, look out for each other. I think I think now, you know, I think that and in general, we live in kind of a self-centered society. And I think, you know, my friends and I always had the rule, we go to the bathroom, whether it was at a frat house or a house party, or we're out at a bar. Yeah. It's 2 people, always 2 people, go with a buddy. You know, we make sure you do a head count before we leave and we go to another place, you know, always trying to have those little things. Cause again, and the thing is, like, you can do everything, right? And if you have some crazy person that, you know, sees you in a random place like this guy did and fixates like that, you could do everything right. And that's, you know, in some ways that that may not save you. And I think, but I think it definitely, it does. I think this case calls into kind of question, like how we as women, how can we, you know, live our lives and, you know, do, you know, how, what we have to do and just be people and not have to always look over our shoulder. I think that's, you know, and I think there's, you know, there's a lot of that conversation kind of nowadays, but I will say the one kind of positive, you know, thing I could say is on TikTok, which I go on not too often, but, you know, I think in the algorithm, a lot of girls are kind of saying that they've now purchased like devices to help to prevent break-ins into their apartments. They've started to lock their doors, even if they didn't previously. So I think, you know, and that can be, you know, it's a deterrent. So I think there is, I guess, again, among college girls, at least, to help look out for each other, you know, try to take some extra safety measures. And it's unfortunate that we live in that world, you know, that we live in. And it's sad to see that, you know, sometimes we have to walk around, you know, with our, you know, our head on a swivel. I know I had my dog at college, so you know, that made me feel a bit better. But I'd walk her sometimes, and, you know, even if it was like dusk, I still, you know, some guys walking behind me, I cross the street, you know, to the other side. I mean, most of the time they would cross the street to the other side because, you know, it's, I don't know. But I think you just have to be, you know, keep your head up, be a little cautious. There's nothing wrong with being a little cautious of people. I think, you know, be polite, but be cautious, I think. But definitely, again, being college, it's an interesting time. And, you know, I mean, the sad thing is these girls and these kids were just kind of doing what they did. And, you know, some crazy person kind of came in and ruined that. The also thing I wanted to touch on was, I think, not necessarily in the true crime community, I don't know, but, you know, there have been some comments of like, oh, why did, like, what was the girl who didn't, I can't remember her name right now, I'm blanking.
Dylan, the one that,
yeah, there have been some, I've seen some comments, not here in chat, everyone's been great tonight, but talking about like, why didn't she do anything, like, you know. And I think unless you've been in that like situation where it's, you know, high pressure, there's, you know, it's a very scary situation, I don't think anyone can really comment. And I think, you know, survivor guilt is real. Survivor guilt is a very real thing. And I think that, you know, again, not anyone in chat, but just in general, in some of the social media circles, people have been like, well, why didn't she call 911? Or why didn't she, you know, I don't know, check on somebody? Or why didn't she do this or that? And I think that, you know, this girl will forever be traumatized and be racked with survivor's guilt because she lived and her friends did not, and she's fine, and she will, you know, God willing, live, you know, a long and I wish her well, but, you know, and her friends won't, and that's a horrible thing. And so I think when people question that, we have to remember that we don't know how we're going to act in those situations. You know, I remember back in first aid training, we did like CPR. When you're supposed to tell somebody, you call 911, because if you say someone call 911, everyone's going to assume maybe someone else will do it, or they may be frozen. You have to like delegate. You got to do that because people won't. You know, you don't know how people are going to act in those situations. So I mean, like, you know, always extend. You know, I hope she's okay. I hope, you know, I wish her well.
Extend her some grace on this.
Yeah, and
absolutely.
You know, Francesca, there was something else I wanted to ask you. Oh, I wanted you to share, because you shared this with me not too long ago about, I don't remember, so please excuse me if I'm misspeaking, something about being in a bar and saying I want an angel drink or something. Could you talk a little bit about that?
Oh yeah, so there.
Have you heard of that, Jules?
No. Mm-mm.
So there, and again, this was kind of circulating on TikTok. I had some friends send it to me, where I guess there was this thing supposedly called an angel drink, where you could ask for it, or a specific drink, and
Bartender.
to a bartender, and that would mean that you need help, or that maybe
Nice.
Now, I've also heard bartenders say, I don't know what that is. I mean, I know now, so if someone asked, I would do it. But I think that's also like,
does bartend is
yes.
part of it. Yeah.
But I think that also goes like for anybody who, you know, has siblings or parents, or anyone who has a kid or someone they know that does frequent out or that's drinking. Oh, I mean, always remind them, like, if you feel uncomfortable or there's like, you know, some weird dude or who, you know, actually weird people can be, you know, anybody can be weird technically. If there's a, you know, someone that's bothering you or you feel like you're not safe to leave or there's some, ask your bartender, reach out, find a security, ask them, because we are all willing to help. You know, we're all willing to help you get out of weird situations. Do not be afraid to ask for help. Please ask for help. I think that's the biggest thing. Like, and, you know, I mean, everyone I know has been in an uncomfortable situation at some point, you know, ask for help, look out for each other. But yeah, the angel drink is a new thing, I guess, at bars. Some bars have specific drinks that you can ask for if you don't want to be super like obvious, like, hey, this dude's or this gal's being really weird, you know. So find out if your bar, if not, like, I know for our local college dive bar, I mean, we were all everyone kind of got very friendly with the couple bartenders that worked there. So everyone kind of knew each other. It was very, you know, everyone was very cozy with one another. So we knew. So I mean, obviously, like, if I thought that if there was some weird person, like, I could always be like, hey, Crystal, you know, and you know, she'd help me out. But you know, I think that's just, you know, ask for help if you need it, really.
Right. Anything else? I mean, that all of this is really good information. I mean, I know that, and you know that I've said this before, that I remember telling Francesca in her last year of college that they weren't keeping the door, and this is after her friend was robbed. And even though Francesca's like, I want to keep my door locked. Sorry. Some of the people, maybe she did, I don't know, but some of her apartment mates didn't. So it's like you could have all the intention in the world to lock yourself correctly in your apartment, but your housemates may not have that intention.
That's right.
My only consolation was that Francesca had her emotional support dog the whole way through college, and she took her with her to college. And I knew that dog, anytime, like, I mean, I've taken the dog for a walk and I've fallen down in the dark. As soon as I've fallen down, the dog is on top of me, barking, licking me, getting help for me or whatever. Right. So I always knew that Mocha, which is Francesca's dog, is so protective that was at least something that I could then lay my head down at night and say, okay, I don't know what's going on in that apartment, but I'm willing Mocha does.
Right.
It's really difficult. Did you have any other questions, Jules, for Francesca, or does anybody
any college life questions maybe I can answer?
I do have a question, Francesca. Please, everybody in chat, please don't get mad at me, okay? Please. I'm just curious about the lifestyle, right? And that is that Xana had ordered DoorDash, and it was being delivered at like 4 or 4:12 in the morning. Would you say that's typical? Is there that level of comfort? Because I wouldn't want someone to come to my house at 4 a.m, but I'm also not 20 years old, you know? So
what are your thoughts on that, Bryn?
Okay. I had a very strict rule. Once I had like even one, like whether it was one shot, one drink, whatever it was, once alcohol
touch your lips,
my mouth, you know, I'm like, I'm done. Like, the car's done. So I would usually do like a last call. Hey, anyone need anything? Do I need to take you anywhere before I start drinking? Because otherwise the car's gone. Like, nobody in our house was allowed to touch their car keys. That was it. We locked them down.
Yeah.
That being said, I think, like, I know personally that there have definitely been some, you know, you get late home from going out or the bar, or, you know, you either can't drive, shouldn't drive, don't want to drive, whatever it is, you don't really want to make that trek. So, you know, I know for my college, we had a Sheetz. I don't know if anyone knows what Sheetz is. It's like a convenience store, food, gas station. They were open 24/7. So after all the parties, people would just Uber to the Sheetz and then Uber back. That was very popular. But yeah, ordering, that's not uncommon. I can definitely say I've ordered, you know, 2, 3, 4 in the morning sometimes, you know, and because I mean, I was not going to leave my house. So, and I guess now that you bring that up, I guess I never really thought about the fact that, like, then they know where you live, but it was always like, leave it at the door.
Right.
And in my apartment, at least, we had there was like two, like a breezeway. So there was the outside door to the outside porch. There was another door, then like little entryway, a door, and then there was
like an anteroom. Yeah.
and then you'd have to go inside, and then there was the downstairs apartment, and then the upstairs apartment door. All of these doors locked. So for me, I guess we just never really, at night we locked them, but we just never really thought that would be, a problem. No, I wouldn't say it's unusual. I would actually say it's pretty on par for college kids,
Okay.
Yeah.
Sorry, there were two people. Number one, there's a Miss McGill, and I don't see. She says, "Could somebody please?" Miss Poppy McGill wants her question answered. I don't see the question, so I'm asking her to ask it. But then Miss Ernestina Clementine has this question, Titi.
How do young people relax and go up by their phone and embarrass them? Okay, so that's actually a really great question. So usually, I was not part of a sorority. Well, obviously not a fraternity, but I never joined a sorority. I had offers, never did. Just was not my thing. But I do know, so I had a lot of friends that were part of fraternities and sororities. So for them specifically, if they had a formal or they were having, a mixer, but it was a closed mixer for a little bit prior to them opening it to the public, there were typically no phones allowed. They usually would have a little time where they could take like a couple photos if it was a formal, or if it was, and then they would say no phones. Once the public arrived, then you could have phones. People had phones all the time.
Why was that, Titi?
I think it was just probably because there were people there that were underage and they were definitely drinking. Like that was, I know for a lot of the sorority girls, they were never allowed to be pictured. There were no photo. They never took photos at a certain point when they went out because they would be drinking, and they never wanted to be caught drinking because they would be sent to standards, and that would be bad because sometimes they get fined, and it wasn't a good look for the sorority. Yada yada yada. I think. Do anyone get embarrassed? I mean, I think for me at least, and I think that I could comfortably say for most of the people my age, we grew up with this stuff. I've watched social media evolve and change. I watched when it first happened, and it was very candid, and people were nothing was particularly curated. We were posting just all of our thoughts on the internet. And now we are, but there's a lot more curation. It's interesting how that's evolved. So I've grown up with this. Like, I think my generation has watched this whole social media and our phones. I remember when the iPhone, everyone started getting iPhones. So we've grown up with this. This is our normal. I don't know of I guess it's kind of sad in some ways. I don't know a time before social media didn't exist. It's been around, I think, at least since I was kind of at the end of middle school is kind of when we all started. So I was about 10, 11. So and at this point, most of the majority of my life, that's been a part, and that it's for everyone my age or so. We kind of, and so, yeah, I know that everyone has their phone. And if I, let's say, did something stupid at a party, yeah, technically people could photograph it or videotape it. And the thing is, like, yeah, that's obviously, I've seen it in, the news and, obviously like the gossip around college and stuff like that. People have gotten, not, in trouble or have been embarrassed by those kind of things. And I think,
yeah, it's been used for bullying.
Yeah. And I think people I think my generation kind of has just accepted it as kind of par for the course. Like, these are the consequences. Obviously, like, if that happens to you, that really sucks. But I think that's just where you I guess you just kind of take the risk and outweigh. Because I mean, if I'm being 100% honest, I don't think
we want you to be honest.
I don't think I've ever really thought about the fact that because I mean, it's never happened to me, right? And I have, that's never where someone has used it in a bad way for me. But I think it's. I don't think we really think about it, to be honest, because again, it's just so part of our lives, just like sleeping, eating, breathing. And again, so there's some people that have kind of gotten offline. I've pretty much gotten offline for the most part. So, but again, it's still so normal for everyone. We had a friend that used to make us all put our phones when we ate together, to put them in the middle of the table so we would all converse with each other. And everyone used to hate her because she would do it. But like, so I think that kind of shows that we're all so used to this. We just part of our lives. And especially with social media, I mean, social media, especially with like, TikTok now, there's like, it's a whole, everyone wants to be kind of get their, be on there and be part of what's going on. And so again, I think it's just so normal. It doesn't really cross our minds.
How many of your friends do you know that have decided to streamline their social media, maybe even completely take their presence off of social media, maybe for mental health issues, maybe for safety, but is that kind of a developing thing?
I think that there are, for me personally, I think I kind of myself, for the most part, taken myself off social media. I don't really post often. I don't do much on there except watch other people's stuff, but I don't personally put anything out there anymore. I think, especially in college, there's at least something that I've kind of, from my peers and from my friends, I think there is kind of a notion, like there's an idea of FOMO, the fear of missing out. And I think especially when, and look, I will say without a doubt, me at almost 24 and me at 20, 21, I see a huge difference with myself and even kind of how I see the world. And so I think there is that huge fear of, well, am I not doing enough, or am I not there? Am I not? And I think now I could care less. I'd rather be at home. I don't want to be anywhere else.
Yeah.
But I think now as a society, especially as my age group, I think we're realizing that social media is it does play a detriment in our mental health. And I think a lot of people are realizing that and taking a step back and realizing when we take a step back, how freeing that is, not care about who likes our photos or what we're putting online, because you enjoy being here in the moment. You just don't care anymore, and having that less care and that off your shoulders helps you so much. And I think, for me, I don't it doesn't matter, and there's so many other worries in the world that are kind of big. It's so, where did she go?
She might have accidentally pressed a button.
Oh no.
Yeah.
Second.
You bring up some really good points, Francesca. There's a lot of people that are suffering with mood problems and identity problems related to the whole online persona, and whether they're being accepted or they get the right number of thumbs up, or if the right people like their pictures or their post. So I am beginning to see more. I'm a psychologist. I'm beginning to see more people young people, college age, saying, I don't have my stuff public. I keep it private. I don't want people to be watching me, things like that. I just wondered if you'd seen that with your own friends.
Yeah, I think, I think everyone's realizing that social media is again playing. It's when because it's so easy to become addicted, right? It's right there. It's super easy. I think there are now like articles and like studies that are saying TikTok in particular is diminishing our attention span because everything's less than a minute. So, but yeah, I think it's definitely, it's good to take, and even if you don't want to log off completely, taking some breaks from social media always helps you. You know what I mean?
Yeah. Well, thank you, Francesca. I'm sorry that I disconnected myself by an accident, but I appreciate your having come on. I wanted, sorry, Francesca, to interrupt you, but poor little Miss Poppy McGill has had this wonderful question for a while now. May I ask it?
Yeah. Oh, yeah.
Okay, so this is not the question that Miss Poppy asked, but we'll throw it out to Jules, Miss Jules. Miss Poppy McGill asked, Bryan, could you please make a comment on Bryan's Kohberger, as a psychopath? Of course, we don't know because we can't tell you, versus autism spectrum disorder versus schizotypal. She, Miss Poppy, does not buy psychopathy. So, of course, we can't make things, but maybe you could speak in generalities. What would make somebody like a Bryan more on the autism spectrum, in your opinion? I could tell you, but you versus schizotypal.
I'm going to tell you, I can't I think I'm going to defer to you to answer that. And the reason that I want to defer to you to answer that is this. I think the rate of autism in our population now it's becoming really fairly expected that you'll have a few of those kids in each of your classes if you're a teacher. I get real nervous about comparing things like crime to the condition of autism spectrum.
That's right. That's what I think.
Let's look at IQ as just one factor, right? It used to be not very long ago, Dr. Latina can tell you, only even maybe 5-8 years ago, where people thought that intellectual ability was somehow related to autism. We know now that's absolutely not true at all. That the bell curve for IQ that you see in the general population is the same exact bell curve that you see for intellectual ability in just the autism population. So I use that IQ as intelligence just as a factor to illustrate my point. That there are more and more researchers that would tell you that people that are on the spectrum, that they don't technically have a disorder, that it is just a unique and unusual, out of the ordinary type of processing.
Mm-hmm.
So I'm a little, I don't want to conflate autism when we're talking about these various heinous crimes. I know Adam Lanza was said to be on the spectrum, and there was quite a hubbub about his medications and did that make him violent? I believe he was on Prozac. But I really think we do a disservice to try to, I mean, it's kind of like saying, oh, the person that committed that crime is a redhead. Are redheads more likely to be violent? So I'd like to hear what Dr. Latina, what her opinion is on it. But for me, I'm a little uncomfortable with that comparison.
Yes, I think, first of all, it is dangerous to conflate autism spectrum, let's call it, with intelligence or lack of intelligence. I mean, there's just, yeah. And one thing I will say, some of the literature points that people on the autism spectrum, and I have had literally dozens in the past 8 years of young adults that they don't even use the word Asperger's anymore. Let's just say on the autism spectrum, who've gone to college.
It's not it. We don't diagnose Asperger's. Some of the schools are still using it, but we don't.
No, it's antiquated. But I was just throwing that out as what, if people want to understand. But I've had plenty of young people that are pretty, I mean, it's not like I think they're on the spectrum, but they're clearly quite on the spectrum of autism. And I will say, this is anecdotally, that I have not had not one of my dozens of middle to high functioning young people in my practice that are on the spectrum ever do a violent crime.
Agreed.
Think about it. Intentionality. Is there a lability? Can they be labile in their mood, especially if you're really in and have true pervasive developmental disorder, which is what used to be called, or that's what we used to call autism. I've had a lot of patients from age 1, 2, 3, and then way into their adulthood that are truly what you want to think of when you think of autism, and that don't have any real consistent interaction with the outside world. And some of them are quite disruptive. I can think of a couple of my patients that are, and I'm 5'11", 5'10 and a half. These young people, guys, were in their 6'3", big people, and they were bigger than life physically, and they were scary. And a lot of them we had on some measure of antipsychotic or a mood stabilizer because they had control outbursts, right? The difference, however, is I think is, for me, intentionality. So
I would agree.
Miss Peggy, Poppy. Sorry, Miss Poppy. I love that name. Miss Poppy's question. Look at Kohberger, for instance. Okay. If you just want to look from afar, again, not having diagnosed him or evaluated him, what would point away for me at a casual glance as a professional that he is not on the spectrum, but would point more towards an antisocial, is that if indeed he did do this crime, he is a violent person. And it was done with intentionality. And
he's mean. He's sadistic. Yeah.
Mean, sadistic. That's very different from somebody who is socially awkward, doesn't really make a whole lot of eye contact, is kind of quirky. All that is in a completely different ballpark than a person, if indeed found guilty, who has done a quadruple murder. I mean, I just have never heard of somebody on the autism spectrum to do such a thing. Now, I want to speak, I had a colleague who's a PhD as well, Jules, psychologist, who we spoke about patients collegially that were on the spectrum and empathy. And he quoted some literature. I was not able to quote it, and I can't right now, but maybe you are familiar, that there is some scholarly literature that says that folks that are on the spectrum, that there is especially if they're really pervasively or either high functioning or not high functioning, that they are not born with much measure of empathy. But he said that you can teach, in that case, you can kind of teach empathy.
We teach it like an academic subject.
Exacto. And his thing, tell me, you can expound on this, was that let's say you have a high functioning, I think of many of my patients, and they don't make eye contact, and they're very into their own little world of their career or whatever they're doing. They're in college, they're not, but there isn't a whole lot of empathy. But it isn't that they don't really possess a potential for empathy. It's that they don't know how to read those it's a processing thing. So they don't know how to read the cues, so that they're not able to step outside themselves to say, she looks sad. So does that make sense?
It does. So they don't really care much about the social relationships.
Right.
They're more motivated by ideas and things, depending on what it is, right? Each one's different. But if we train them to notice cues and whatnot, like a lot of them, I teach them, well, where does anger live? And anger lives up here at the top of your nose. And when you're angry, all your face goes to that center point here. And then we practice it. And you can see them really trying to get their face to contort, down into that scowl. Once you teach them to recognize it and then to mimic it, then you can say, well, how would you respond if you saw that? And so we'll role play, and things like that. So it can be taught, but it is more of an academic lesson, and the earlier in age that they begin to go through that form of training, the more likely that they'll begin to demonstrate these behaviors, and it will look like a more natural form. If they don't begin to get that type of training until they're a bit older, 15, 16, it always looks just a bit practiced, fake. But if you can get them they're really young, we really want them practicing and whatnot. The schizotypal, I get Poppy's question, but I wonder, rather than schizotypal, what would you think about possibly schizoaffective for Bryan? What is your opinion of that?
For me, you're asking me.
Yeah.
Okay, so let's just back up a little bit and say, Poppy and folks in the chat, the schizotypal and schizoid are personality disorders. So they don't fall into sort of the organic, physiologic mental illness like schizophrenia, or let's say depression or anxiety or OCD, that kind of thing. Those disorders that I just mentioned, schizophrenia, even schizoaffective, bipolar, anxiety, generalizing, those medication can help. Not that there's a magic pill, but it can help. Whereas with personality disorders, as Ms. Jules said earlier, a personality disorder, like our own personalities in general, are part of, I always say it's part of the fabric of who we are. It's just part of who you are, right? So there isn't really a magic pill that says, okay, the person's schizotypal, and we can talk about what is that in a minute. That's more of a personality disorder that has to do with people, I'll just generally say, who tend to be loners, be pulled back. They have sort of quirky ways in the world.
They're a bit timid.
And timid. And so
yes.
You're not going to see the whole violence thing. And
correct.
So, you have to kind of look at, like we said earlier, there are overlaps in life of many of these different diagnoses, whether it's a personality disorder or mental health disorder, or let's say a mental disorder. And there are overlaps, but then you have to say, what are some of the things that are unique in some ways to a particular diagnosis or pattern of behavior? So if you're talking about schizoaffective, the way I see schizoaffective, this is my simple mind's way, is if you understand schizophrenia, which is a thought disorder, it does have a genetic basis. It's a thought disorder where one can have auditory visual hallucinations, paranoia. There are many hallmarks of this. It can be quite debilitating. In my experience as a physician, the vast majority, even my high-functioning schizophrenic patients, don't generally get married and have really solid long-term relationships. They do, some do, but that might be a hallmark, let's say. Bipolar is another mental illness, which is manic, or where you get highs and depression lows, or you get a mixture between. That also has a genetic basis. It can also be managed. People with bipolar,
and you can get a bit of psychosis in the manic phases as
yes,
well.
you can,
Okay.
and even in the depressed phase, for that matter. But those folks generally are quite socially high functioning, especially if they remain on their medication. So I've had doctors, lawyers, teachers, and anybody from all walks of life as a bipolar, and if they're in therapy and well medicated, they live a totally normal life.
Right.
I've had a number of schizophrenic patients that have had very high functioning life, although much more difficult. Then in the middle, I think of schizoaffective, where you have pieces of schizophrenia and pieces of a mood. Affect is really an expression of one's inner mood. So a mood disorder, I think of bipolar as one of the mood disorders. So is depression. There are many mood disorders. So schizoaffective is in the middle. You've got pieces of schizophrenia and you've got pieces of an affective disorder like bipolar. So a person with schizoaffective generally is not quite high as functioning as a bipolar. When they get sick, they get much more delusional and paranoid than a person necessarily who's bipolar. But they're not as ill as a person with schizophrenia. A person with schizoaffective disorder can attain high places both professionally and interpersonally. I think there was somebody recently that said, "Oh, the person has schizoaffective." It was some other crime. I can't think of it right now. I'll think about it and revisit with you. And I thought, no, this is not it. I don't know if I don't know enough about this young man's moods. Because you could be depressed, and that's what we used to call Axis 1 diagnosis, let's say depression. And then you can have a personality disorder and you could be a psychopath. I mean, so you can have both. Right. And I don't know enough about the cycles of this young man's moods. I don't know about his lability. Is he easily irritated or not? And I don't know about his relationships with family and friends. So I
think some of the postings on Tappa Talk suggested some pretty serious mood reactivity. So
But is that drug related? See, we don't know.
You don't know if it's drug related, and you don't know if it would meet that level of hypomanic, or you don't. But just, I thought that was a really great question by Poppy about what do you think about the schizotypal compared to antisocial personality disorder? And I thought, well, maybe he reacted, maybe he is schizoaffective, maybe that's. And for those of you, schizoaffective disorder is a pretty rare condition, don't you think?
I don't think it's that common at all. And here's what would point away from it, with all due respect to you, is if you think of somebody as schizoaffective, I just don't see the whole planning, sadistic piece of that. The fixation, like Francesca talked about, somebody fixating on this girl's or whatever, and then stalking, and then scoping out the house. None of that really, I see that as a part of the constellation of behaviors that we see with schizoaffective. This is, it is, mental health is an art and a science, really, right? Yeah. There's not just, here's your pill and get better. It's so complex. And Janet here asked if we would at some point discuss the Vallow-Daybell. I would love to. And that's how I first got into the true crime when I was on Profiling Evil, is I weighed in on a couple of things.
Yeah, the Vallow-Daybell case is just, the wrong crazy met up with the wrong crazy, and you ended up with just an explosion of.
It was like what we call a folie à deux.
Oh yes, absolutely, yes.
But it would be bear looking into that. That's a really good question. I totally.
I love Jazz Dawn.
Yeah, that is such a great question, and thank you for the super chat. That is a great question. I mean, it's confounding.
Okay, so let me say this. Okay, so the aunt that had the story about the whole vegan and whatnot. There's things on Tapatalk that suggest no, he wasn't vegan, because he's talking about the paleo diet, right? He's talking about the paleo diet and adding in some carbohydrates or gluten or something, or taking out gluten or something. But anyway, the aunt that originally inserted this idea that he's this radical vegan, this was, if I remember correctly, get it right, this was the mom's brother's divorced wife.
Mom's brother's. Okay, so the ex-sister-in-law.
Yes. Yeah. Well, the ex-aunt, the ex-maternal aunt-in-law. That not even the biological sister, right. The spouse of the brother, of the biological brother. So it's quite a far removed from that core family, right?
It's called a kissing cousin at most.
Sure. So I'm a little bit skeptical. How I will say this, Jazz John, sometimes narcissists will, just like they would love to have a rare condition and say, oh, I'm special because I have a rare condition. They'll do things like do extreme behaviors as a way of making themselves look special, stand apart in a way. And so saying, oh, I'm this perfect vegan. I mean, Chris Watts certainly did it, I've seen him do some pretty, unusual things to just say, I'm unique. So I don't know. I'm not altogether convinced that he's vegan. Let me just say that.
Yeah. There's so much more. I'm thinking that we're a little bit over the 2 hour, I think, period of time. And there is so much more. I'm just wondering if folks would be interested in us reconvening to discuss maybe in next week or the week after on a live. I think there are issues that I personally would like to discuss. We didn't even get to how do you deal with trauma and
I know
that, but also issues people have brought up around eating disorders, that his weight issues, eating disorders, obsessive compulsive disorders around eating, and how to discussion around body image, body dysmorphia. I mean, there's a lot that we can unpack that I think we could talk about, not only with respect to Bryan and his journey with the weight issue that we don't quite understand, but that might also help other folks who are trying to understand about eating and overeating and body dysmorphia and loving yourself better. And I guess that's one thing I was hoping to revisit or to visit. And then another thing is, what was the other thing? Oh no, I had just thought about this. It had to do with Bryan Kohberger. Now I've forgotten that, but the other one would also be trauma. And there was a third that I can't remember now that I thought would be worth talking about. Would you like to reconvene with a change?
I would love to reconvene. I think on your bullet points, we were going to talk about the 3 response styles, reactions to trauma. I think you had listed the 5-factor model.
Yes.
I usually look at fight, flight, and freeze, but there's 3 kinds of freezes. So is that 5? That would be 5.
Well, we also talk about the fawning. This is the chronic responses where people tend to be saccharine and as part of their trauma response to be over ingratiating, and that's the fawning. You get the flop, which I've had patients literally in my office that have literally flopped. I took a Band-Aid off one guy. This is going back 25 years ago, a young strapping gentleman. I literally took the Band-Aid off his knee and he flopped.
Blam.
And then he had a grand mal seizure.
Oh.
I'm not kidding you. And he'd never had one before. And then he had a grand mal. Then he had a post-ictal. So he was like unresponsive for, and the 911 got called. So, I mean, that can be a real thing where people as a trauma response just dissociate or they flop or whatever. So yeah, we didn't discuss. So how would you like to proceed, and would folks be interested? The physiological effect of trauma is something maybe we need to continue with our list.
Yeah, I agree, because I felt like the one topic about, can people really heal following a severe trauma? The answer is absolutely yes. I mean, if we didn't know how to treat it, then we wouldn't have a job. But we break it down into very specific skill sets, and maybe we're processing trauma or loss, and then we're developing mindfulness skills, and then learning how to manage distress tolerance, emotional regulation, and you just break it down into those domains, and you develop skills and role play and all other kinds of techniques, and people do absolutely find their way out of those trauma reactions. Go ahead.
No, I think it would be wonderful if you would come back and we could talk and dive more into that with you. And I have some outline also around approaches depending on what type of trauma, etc. And I would be interested. You see Tyler Feller's here. Maybe we can have him come up a little bit next week if he's available, even to talk a little bit about, from a spiritual perspective, how does one get beyond the trauma? And I think this is a really important topic because of this poor young lady, Dylan. I can't think of her last name.
I agree.
But people are sort of castigating her for her response. And she and that other survivor, the other roommate, will be, as Francesca said, forever affected psychologically, socially, emotionally, spiritually. The question is not, can they be 100% healed? But the way I like to look at it is it's going to be a scar on your soul and your spirit. Can you not have a keloid scar? Can you get the scar to be softened? And can that scar just be there and take a background and not be the foreground and be angry and festering all the time? That's sort of a metaphor for trauma. Yeah. So I really think that's a very interesting thing that we can talk about.
And a necessary topic. I think
it is necessary.
Yeah.
Because what's the point of us just saying the person should have called 911, they shouldn't have, they're terrible, they're not I mean, let's go beyond that very superficial conversation. No?
And I agree completely. And there's a really important factor here, especially with Dylan, and that is that she has a pre-existing condition of PTSD from an earlier trauma. So being confronted in this moment, she very possibly could have had a moment of kind of depersonalization. right? Where she just sort of kind of went, okay, I'm numb. This isn't happening. It's got to be a dream. It is a real thing, y'all. It is. And it's survival. It's just the brain trying to help us survive. So we need some grace, I think, where Dylan is concerned.
I think we need to cut her some slack. Francesca, I wish I don't, the chat is moving rather fast, and people are asking questions. I wish you could put up a couple of them maybe for us, Francesca, and we could.
I'm scrolling back now and looking to try to find some.
Hello, Francesca. Okay. And Tyler said he thought it was a great point. He was not aware, Miss Jules, about the previous PTSD, and I'd heard something about that, but I wasn't really aware of that too much either. So yeah, that would. And Tyler, would you be interested in coming back up? Not tonight, because we're running in now. We're starting our third hour, but I'm thinking sometime next week. Maybe it would be. Okay, please discuss the visual snow. Okay, I do have website links that I can put up. And we did, Miss Lisa Rowe, de Waller-Bridge. We did discuss that. I don't know when, sometime tonight. But do you want to kind of give a little overview again quickly before we go on the visual snow, Miss Jules?
Okay, so visual snow is believed to be a brain-based problem, although they're continuing research related to the eye and the optic nerve. It's only prevalent. It's only found in approximately 2.2% of the population. They've divided up, I think, 7 or 8 different perceptual anomalies. But to get the actual diagnosis, it needs to be present for 3 months, and there needs to be at least 3 of the anomalies.
That's right.
If you go back, Liza, we actually put up examples of the different types of anomalies and what it would look like if you were to have visual snow. It does seem to be, there is a statistically significant correlation between illegal drug use or some prescription drugs. One of the biggest that they found is with ecstasy, MDMA, and marijuana, that people can use one of those drugs and develop visual snow for the first time. What am I leaving out?
Well, I think that there have been in the literature some instances of use of the class of antidepressants, SSRIs, like Zoloft, sertraline, that may, and Wellbutrin, that may or may not be associated as a short-term trigger of visual snow. Also, the use of stimulant medicine.
Yes.
But this is incredible, guys. We're talking like it affects worldwide. Visual snow is 1 to 2% of the population. And of that 1 to 2%, it's minuscule amount that may have used a stimulant or an SSRI, not enough to even make a black box warning. So It's not something, therefore, everybody should now go home tonight, get off their medication. No, let's not do that too much. Did you see what Marlena Cantu, I'm going to put her up, what she just said. Can you read that?
Has a chilling 4-minute video on him interviewing child serial killer Brandon Winston, where Brandon reenacts.
Oh, yes. I saw that. And that
I haven't seen it.
Well, I think I'm not sure why Marlena brought this up, but that point goes back to your point with respect to this cold, completely distant, non-feeling, when this man reenacted on Chris. It's an old video back in the day. Like, I think it's in black and white even. And how he just methodically went through, and then I did this, and then I stabbed, and whatever. And there was absolutely no affect. No, he was empty. And it was just like, it was no big deal.
Yep.
And, that I do think Marlena, that is, I think that video clip was compelling because it really showed in vivo the mind of a true psychopath, right?
Yeah.
So I thought that was very interesting.
Look at Chris Watts. He does the unthinkable with his 2 little babies that he plays with all the time. He apparently loves, right? He does the unthinkable, puts them in the most in-hospital environment imaginable. He finally tells the detectives well, this is where you'll find them. And let me put a letter here for, Bella's in this one and Cece's in the next one. And within 5 minutes, he's eating pizza. Now, y'all think about this for a minute. If you have to recount the death of your dog getting run over, you're devastated, right? You're not going to say, hey, I need some pizza, man. I'm hungry. And yet here he is talking about his 2 children in these oil tanks. And of course, his wife. But I'm just talking about that critical connection between parent and child. In these 2 oil tanks, he writes where they're located, and then he sits down and eats pizza. What else would explain it other than there's a disconnect? Something's wrong emotionally.
Yeah, there really is. So are you familiar with the Austin Haroof case? I'm not.
Mm-mm.
I'll write that down and we'll take a look at that at some point. But I do think our next, I would really like to finish our curriculum.
Yeah, he had some great bullet points. Oh, I know this guy.
You do?
I know the Haroof. Yeah, but I think wasn't he using the spice? I think or that alligator crocodile stuff.
Kratom?
Yeah.
I don't know.
Yeah,
Was
something like that.
Ate the face or something?
Yeah.
Bath salts? I've got to look that up.
Yeah. Bath salts. Maybe that's what it was. Yeah.
All right. So what I think we're going to do, I don't really know how to end these things in terms of the etiquette of, how Miss Poppy, please talk about autism and schizotypal idea versus psychosis and narcissism. I guess we can revisit that late, right? Because we kind of did talk about that, no?
We did. Yeah, we did. So just without talking about crime, right?
Right.
This idea of schizotypal with psychopathy and narcissism. So with schizotypal, you're talking about a personality type where there's social awkwardness, there's discomfort, but it is qualitatively different than you see with autism, because people that are schizotypal, they would like to make a connection to others. Mm-hmm. They want a relationship, but they can't overcome these very real social limitations that they're experiencing. Okay, whereas with autism, they may be a bit socially awkward and unable to kind of navigate that social strata, but they don't really care about it anyway. They're much more excited about whatever their pet idea or topic is, or ideas, right? That do you want to add to that or correct me or what?
I was asking I'm a bad girl. I was busy trying to type something to Tyler.
Oh, okay.
I'm asking you to
Okay. So schizotypal, even though you do get that kind of discomfort socially and maybe a bit of awkwardness, I think the real rule out is seeing that the person that is schizotypal, they would actually really like a relationship. So it's painful for them because they want to be a part of the social milieu and they can't access that, right?
They want to affiliate.
Yeah, they would like some affiliation, but they don't know how to get it. You don't really see that so much with autism, although they can develop a sense of affiliation around an idea like building a rocket. If there's 4 or 5 and they're all building a rocket, then they can absolutely be invested in the group. But without that bond on an idea or an activity, you don't typically see that. They're usually more comfortable to just be by themselves with what their favorite thing is, depending on
I did date somebody way back in medical school. And hi, Tyler. Hold on one second. I got to tell this little shaggy dog story. I'm not giving names or anything, but he was a delightful person from afar. I only went out with him a half a dozen times, but he was apparently building a small submarine in his apartment. And all we did was talk about his submarine and how he wanted to have this sub. And I thought, you know what?
See, that is high functioning autism, right? I mean, and the funny part of it is he's building a submarine that's functional. It's gonna work.
Anyway, Tyler, how are you? Is Tyler there? Hello?
We can't hear you.
He looks like he's about to go either into space or into a submarine.
Or the submarine, right? Looks like an
You
astronaut.
guys did such an amazing job. Everybody, not just myself, but hundreds of people on the stream today were so encouraged by both of you, really attacking what's a very difficult topic, but doing it in a way that's not just informative, but constructive for our own lives. And so I just want to honor you and say thank you to both of you for doing such a great job. And Francesca, too. Great job.
Yeah, Francesca's amazing. Yeah.
Francesca, did you hear?
Thank you. Thank you. Thank you.
So we would love to have you back, Tyler. God willing, next week. I don't know if a Monday or Tuesday we can all meet some other way behind the scenes, but maybe you would like to end in prayer, Tyler. That would be wonderful. I don't publicly pray very well, so
Yeah, I would love to. So, yeah, let's pray. Thank you, Jesus, for everybody that you brought together on Dr. La Latina's stream today. I thank you that your grace is sufficient for every single person, sufficient for us. And Lord, I pray that every single person tonight, as they're going to bed, gets restful sleep. I know that sometimes these cases can weigh on our mind and even interrupt our sleep. But in the name of Jesus, we just canceled the attack of the enemy in that way. And I thank you for peace. And Lord, we lift up the families to you. We lift up Xana's family and Ethan's family and Maddie's family and Kaylee's family, that they would send supernatural peace that surpasses all understanding in this season. That's what your word says. And your word says you're close to the brokenhearted. So Lord, I pray that their spiritual senses are awakened in a new way to encounter you. And so we bless them in Jesus' name. And I bless everybody on the panel today with your supernatural love in Jesus' name. Amen.
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 Do we want to add for Dylan, and I don't know the other roommate's name, but I feel that
Bethany.
Bethany.
Yeah, Lord, we just bless them. They're going through so much, and I pray that you'd make them immune to even the attacks of the people on the internet, that they would just not even be fazed by it. Lord, you actually have the ability to do that, and so I bless them, Lord, and I pray that this is going to be something that isn't a setback, but instead it's a set up. And so I claim over Dylan and I claim over Bethany what your word says, that you take what the enemy meant for harm and you work it out for good. And so I thank you, Jesus, that you're working it out for good in Jesus' name.
Amen. Amen.
Yes.
All right. Good night, everybody.
Bye, y'all. Thank you.
Thanks to Jules, Tyler, and Francesca. God bless everybody.
Good night, guys.
Night,
Bye,
night.
y'all.
Good night.